All right, good morning, everybody. It is 11:06 a.m. on Tuesday, June 25th, 2024, and this is the Texas Behavioral Health Executive Council. My name is John Belamowitz, and I am presiding over this meeting here in Austin. Chair Canseco is here via Zoom today, but somebody has to actually have the gavel in the room in Austin, so that's me today, and I'm proud to do so. We'll go ahead and start with the roll.
Absolutely. Chair Canseco.
Present.
Mr. Belamowitz.
Present.
Mr. Brumley.
Present.
Dr. Cartwright.
Present.
Mr. Hallbauer.
Present.
Parrish. Ms. Pryor.
Present.
Ms. Smith.
Present.
Dr. Taylor.
Here.
Very good. We have a quorum. We'll go ahead and begin with general public comment limited to 3 minutes per person unless otherwise directed by the presiding officer. We're not going to take any action or matter raised during public comment that is not on the agenda, except whether to decide to place it on a future agenda item. If you're participating via Zoom, you can use the raise your hand feature and we will get to you. And is anybody in the room wanting to give public comment? Very good. You'd step right up. And if you would state your name, who you're with, and feel free to address us. And we thank you for being here.
Good morning. My name is Philip Crum, and I'm here in my dual capacities again as Joe Citizen and co-founder of the Association for Mental Health Professionals. And thank you for being here in person this morning. And thanks to McGregor for running AV. Couple of points I want to make too this morning is on council accountability. We've been watching these proceedings for a couple of years. We need more council members like John Belamowitz of the Psych Board, who apparently doesn't mind asking the hard questions and dealing with friction to achieve the desired outcome. That's the type of cross-board accountability the council process needs. The council only works as intended when professional members from one board hold members from the other boards accountable, when the public members question and hold the professional members accountable, and both seriously question the need for any proposed rule. A checks and balances system properly implemented produces a positive friction. I've heard board members say, "What's it going to hurt?" as a reasoning to pass a rule. That's a hard failure to ask the pointed questions and hold your colleagues' feet to the fire when necessary. On the rulemaking process, I'll make 4 points based on what we know and what we have repeatedly witnessed. Number one, according to the rule book, subchapter B 881.2B on page 16, the council is the final line of defense against ill-advised rules proposed from any source and has the final say on what proposals are passed and which ones aren't. The boards cannot be blamed for bad rules passed. Number two, there's a checklist of items in the same subchapter, against which all proposed rules are to be measured. The apparent ease through which this checklist is navigated to get highly questionable rules passed is very telling, and this needs to be addressed. Number three, the 6 questions I just referenced in that checklist are understandably written by lawyers for lawyers, but they are not user-friendly. We've studied that checklist and frankly still have no idea what several of those questions are asking. We've even drafted a preliminary revision of those rules if anyone's interested, in an effort to make them more effective as the restrictive screening tool which they were and are intended to be. We'll be submitting a request to the quadrennial review team that the checklist be reviewed and rewritten for clarity and simplicity to the satisfaction of both the attorneys and the board and council members who need to use them. We would also like to see a public review of each of those 6 questions before a vote is taken on each rule. Why can't that be incorporated into a publicly transparent proposal assessment? And number 4, we would think it good practice that no one from a board that proposes a rule be allowed to make a motion to pass or second that motion at the council level. Other council members should have to do that. We would like to request that whoever has the authority to initiate that change discussion, please do so, and let's eliminate that apparent conflict of interest. The BHEC model is unique amongst state agencies, which means other states are watching. Even if it wasn't, this is Texas. People are always watching. Our council needs far more interboard accountability, and the rulemaking process has a few holes in it that need to be plugged. It's not hard. We just have to want to be better.
Thank you for your
Appreciate
comment.
you listening. Thank you.
Anybody else in the room? Please.
While she's coming forward, Mr. Presiding Officer, I just want to note for the recording that the time is 10:11 a.m. You may have said 11.
You know what? I didn't change. Thank you.
Yes.
For the clarification. Something is wrong with my clock on here.
So we
different time
we
zone.
started the meeting at 10:06 a.m.
Thank you. Go ahead.
My name is Kathleen Mills, licensed professional counselor supervisor. I am also the co-founder of the Association for Mental Health Professionals. In the last BHEC fiscal year, only 110 complaints survived the initial BHEC staff review and went on to some form of disciplinary action. How well are licensees policing their own activities? The answer is less than 1/6 of 70,000 counselors received an official reprimand from the penalty matrix. That means counselors are doing a pretty damn good job of self-policing. We will be submitting to the quadrennial review team a list of rules passed in the last 2 years with questionable basis for existence. We'll be requesting that they be repealed as not originally necessary in their development. That list will include the 2023 CE requirements. This mashup of rules simplified nothing, addressed no empirical problems, and was driven only by an academic desire to control the direction of our profession. 1.5 pages became 5, and it complicated the BHEC administrative effort. Most licensees are still very confused, and that's a real problem you created. I took a cultural diversity course in grad school, and BHEC's not getting complaints about diversity issues. So repeal this requirement in its entirety. There's no empirical basis for it. Remember, less than 1/6. Crisis management. This is a classic government overreach. Require 100% of the people for something that only 5% might utilize and ignore existing resources and infrastructure that adequately addresses the issue. Repeal this. Telehealth. Regulations for telehealth, texting, and AI already exist in the federal HIPAA code, making this regulation redundant. Reference the code from the rule book and repeal this rule as redundant. Supervisor refresher. The current requirement states that 6 hours need to be related to supervision of an associate. Are my 6 ethics and my human trafficking hours not related to the supervision of my associates? Any additional coursework I take also satisfies your current refresher requirement that it may be related to the supervision of an associate. So why is this rule necessary? We're suggesting that each board and this council take this opportunity to use to clean up the rule books beyond merely what comports with state law. Do that with the understanding that your licensees and agencies in other states are watching to see what you do with this opportunity and the BHEC model. AMP is suggesting Texas raise the bar for the nation. Your state mandate as our licensing board and council is to protect Joe citizen, address licensing and ethics issues, and obtain more and competent counselors for Texas. Please stay out of the counselor improvement business. Rather, stick to pages 40 to 41. Thank you so much.
Thank you for your comment. Anybody else in the room? Good morning.
Good morning.
Please just tell us your name and who you're with.
I'm Rhonda Kimball, and I'm an LPC and far less formal. Christopher, I read over the rules that were being reviewed and was satisfied with 681.220 on the religious practitioners. And hopefully everybody's going to use their discernment when they're looking at that. When you run into a Christian who does clinical counseling. I don't do Bible counseling. I don't do conversion counseling, but I am a clinical counselor and want that protected. I am a Christian and will always be and will point people to Jesus Christ. So I have to have that freedom in my practice. That's my concern, but I think you addressed it with that rule. I'll let you know if anything changes.
Can you tell us that rule number again?
681.2 20, item 20.
Thank you.
Okay. I want to speak to something I learned recently at a training, that an associate is being sued by her supervisor because of a non-compete clause in a contract. Now, when associates are paying for a supervisor, they should not be allowed, supervisors should not be allowed to trap an associate into a contract while they're getting their hours. They should be educating them as to what contract law is for associates, what it means to join a practice. That should be part of the education. It is not part of the education in school. So, and I see lots of lawyers here, so this needs to be addressed, because associates who make no money, who are required to pay a fee for a supervisor, should not be sued by that supervisor, period. There should be something on that supervisor's license now that says no. Anyway, that needs to be looked at. I don't know of any rule that's addressing that, but it needs to be there to protect the associates who are now allowed to make their own income. They don't have to go through a supervisor to get their income anymore. That recently changed. So that might need to be looked at. I want to also address BetterHelp, Headway, and any of those mega business models that are taking over counseling that, you know, for the pandemic, we were allowed to do telehealth. I think telehealth is great. The rural areas that don't have counselors and stuff, but texting, they allow texting. That is an option to text a counseling session. It should not be allowed because we know evidence-based says the relationship between the counselor and the person is what brings a healthy outcome. Evidence-based, people, this is what we want still. So that's not happening, and they are taking counselors by the droves. And how come those counselors are allowed to do it? They are licensed like we are. Why is there no penalty? The pandemic is over. The rules of the pandemic are over in Texas. We're held to the former standard, and that needs to be looked at. Thank you.
Thank you for your comments. Anybody else in the room? Should we get public comment in the room? Okay, we're gonna switch over. We've got, looks like 3 raised hands
Can I ask
over
a
Zoom.
question real quick?
Sure.
Our attorneys, have we, the FTC law that passed or rule that passed not too long ago is banning non-competes in the US? I mean, has that had any effect on us yet, or is that not official yet?
I don't know that that rule is technically official. I do
Okay.
know that because there are some lawsuits challenging the rule.
Yeah.
But I mean, it would be, if it is a valid rule, it would impact.
And then that's something that the courts would just throw that lawsuit out if that were to happen.
Yeah.
Presumably.
It's affecting everybody. I mean,
Yeah.
every profession, licensed, unlicensed, changes a whole lot. So I think that would be something to depending on how that court case and winds through and what happens. I think that would be logical to put on an agenda, perhaps depending on how that works out. But okay, back to public comment. We've got 3 raised hands. And just a reminder to everybody, if you will please state your name and who you're with for the record. And for 3 minutes.
All right. First up, Gretchen Rudy, if you'll unmute yourself.
Hello, my name is Gretchen Ruddy, and I'm just a citizen and a mom. And I am concerned about a licensed psychologist here in Houston, Texas. Her name is Dr. Blythe, 2 sisters. Her license number is 36566. And in your rule number 882.32, it states that it is the licensees must update their name, main address, business address, email within 30 days of a change. Last July, Dr. Blythe, 2 sisters, moved from her office on Commerce Street and moved into her office into a home that my daughter owns and set up shop there and never changed her on her website, her address. Not to mention it's illegal for her to be operating out of a residential home. She changed her driver's license to state that she lived at that residence, when in fact, she moved into a home, an additional home my daughter bought that month, and is living there with my daughter and her 3 children and Dr. Blythe's husband, even though she says she's queer, and another woman, her sister. But they still claim that they office on Commerce Street out of Common Desk East End. And I have been in contact with that company, and they have an email. They told me they have moved out. They do not office there. So that is violating one of your rules and regulations. Additionally, I would like to read to you a text message that I received from a former victim of Dr. Blythe's. I received this last November, 2023. Good morning, Gretchen. I just watched this documentary called Twin Flame Universe. If you haven't watched it yet, it's about a cult. It really reminded me a lot how the 2 sisters operate. They come across.
Miss Wright, let me interrupt. I apologize for just one moment. Just to mention, if any part of the text you're about to read us contains any sort of health-related information or HIPAA information, if you would please not disclose that, as this is a public meeting. We certainly want to get your feedback, and we've certainly noted this complaint, and I would encourage you to contact our office to submit a written complaint for our investigators to be able to go out and investigate. And certainly please continue to proceed. I just wanted to make sure that you don't inadvertently reveal any sort of protected information in this public setting.
Okay, I don't believe there's any, it's mostly referring to her experience with them. I don't know that that would be protected.
I will let you use your judgment. Just please be cautious.
Additionally, I have sent in a complaint and it was dismissed, and they actually sent me an email telling me not to send any more complaints in. And I was advised to address your board with this. It's very concerning. And she's licensed by you. Anyway, I'll continue with this. They sell their curriculum to vulnerable people and get them locked into cult and prey upon them. And so I asked her, I told her I watched the movie. And I said, I'm curious if it's similar to Hottie Hoop Camp. They advertise that Dr. Blythe gives brain spotting sessions. Our daughter estranged us after attending in 2021, very out of character for her. We had no altercations. We are devastated. They are using her big time. It's so horrible. Her reply is yes.
Ma'am, the time has expired.
Okay.
Thank you. Thank you for your comments. Got the next one?
All right. Next public comment, Mr. Brian Mayers. If you would unmute yourself.
All right. Good morning, everybody. My name is Brian Modis. I am the Government Relations Director with the National Association of Social Workers, Texas. I wanted to simply just thank everyone for their work in supporting the profession boards and share that we support Rule 781.302 up for consideration under the social work rules, and especially appreciate the changes that the Social Work Examiners Board made during their meeting yesterday, clarifying the work as social work, and that we also support the rules up for consideration in support of 882.14, which grants greater flexibility to applicants. I also want to make one more comment that a previous individual mentioned, having to do with larger entity or mental health entities delivering services to consumers and patients. And that is that, hang on one second, I'm pulling this out. Here it is. I was hoping that the council would consider looking into the corporate practice of medicine doctrine, CPMD, which is deeply rooted in Texas law as part of the administrative code and predicated on protecting the interests of patients. The CPMD delineates between corporations, entities, or non-licensed physicians and dentist ownerships and the authority to control or influence clinical decisions. It also addresses how essential medical care services are administered as opposed to operational or business services. So my ask or plea for the board is to examine whether these CPMD protections can and should be extended to licensed mental health practices as larger entities that were brought up earlier continue to provide services to patients in order to protect the integrity of care. And that is all.
Thank you very much.
And Dr. Terry Ann Sartor.
Good morning. My name
Morning.
is Dr. Terry Ann Sartor, and I'm a licensed professional counselor supervisor in private practice, a counselor educator, and the liaison to BHEC for the Texas Counseling Association. I am grateful for the opportunity to serve on the BHEC Rules and Standardization Committee. TCA appreciates the council for allowing stakeholders to make public comment to express concerns. We have a strong appreciation for the council and individual member boards. We are thankful for the council and licensing boards have also moved public comment to the beginning of the meetings as a way to ensure additional concerns are heard prior to the voting processes. Thank you for allowing TCA to have a voice during the quadrennial review process, and please let us know if we can be of assistance. Additionally, we appreciate the proposed new rule of 882.12, petition for waiver or remediation of deficiency. As we all know, there is a mental health provider shortage, and we are hopeful this can assist qualified mental health professionals in becoming licensed in the great state of Texas. Lastly, with the council and the boards returning to in-person meetings, we appreciate the continued opportunity for the public, current license holders, and the future mental health professionals to participate via Zoom and/or review the meeting later. This is a great resource for the next generation of mental health professionals to learn about the minimal standards, professional expectations, and advocacy. To the members of BHEC and all the licensing boards, we appreciate your service, time, dedication, and the diligence in working together to promote consistencies across licensing board rules. TCA truly appreciates and respects all the efforts of our volunteer boards. Thank you for listening to our comments, and please let us know if we can be of assistance.
Thank you very much.
I show no other hands raised.
All right, so last call real quick. If you have public comment, now would be the time to raise your hand. And seeing none, we will go ahead and close public comment. No further comment from the room. All right.
Mr. Presiding Officer, I would just note that you did receive 4 written comments that were sent to each of you yesterday evening.
Yep. And I reviewed those. Thank you for noting that. We're gonna move on to agenda item 4, informational items. This is all informational. Staff, is there anything that y'all want to lay out for us specifically to look at?
I would just highlight under C, the licensing numbers. You'll note, as you have been noting, that we continue to grow in basically all the professions. And so having some record growths each quarter. And we will get to the strategic plan and the legislative appropriations discussion, but know that the performance measures and the financial information was what drove a lot of our decision-making to put before you today.
Very good. Agreed orders and dismissals. There's no action needed there. If anyone had any questions, they could ask. We have our PSYPACT commissioner here. Do you have anything on PSYPACT you'd like to tell us about?
Just briefly, we received our report card for the first quarter. We're in compliance, so we're doing everything well with them. And
Let's clarify. We are in
compliance. We are complying. Yes, there's nothing out of compliance with PSYPACT, correct? We starting next month, that'll be up to 42 enacted jurisdictions, and there's over 12,000 APITs, authority to practice interjurisdictional telepsychology. So
You tell us those numbers again.
it is, I think it's 12,700 approximately have been issued. So
Okay.
those are people that can practice into or out of Texas into the other 42 jurisdictions. So
There's a reason I asked you to repeat that. I think that it highlights some things that are at stake regarding the EPPP2 discussion later and the consequences of if we get sideways, some of the things that could go wrong here. So thank you for that clarification. I think Dr. Cartwright's going to talk to us about that as well with some of his concerns later. Anything else there?
no, that's generally it. So
Okay.
still moving forward. There's a mid meeting in July, and then November there's another meeting for SIPAC.
And
That's
Chair
it.
Canseco?
I have a question. When you say jurisdictions, does that mean other states or smaller jurisdictions than an entire state?
It includes states as well as other jurisdictions like Guam, I think, or double check that actually. But
Canadian
there are,
provinces.
there's DC is joined.
No Canadian provinces, John.
That
Thank you for
addresses my
clarification.
question. I was just curious to know how big, how little is it a county or state? Thank you. Appreciate
No,
it.
we would have to enter into a treaty in
That's
order
right.
for them to join SIPAC. So
That's a good
it has to
clarification.
only be states. Yeah.
Thank you.
Sure. Patrick, how's New York coming along? You know, that they were kind of close. But I was curious.
They filed a bill, but there really hasn't been any action on it. So the bill is just left pending. New York has two bills. They were introduced in 23. Yeah, and they haven't moved. Same with Massachusetts.
Thank you.
You can see if Janie's on the Zoom.
Dr. Cartwright, one follow-up on that with my Frogger voice here. New York, I was watching one of their meetings. Their board actually opposed the SIPACT legislation. Those boards, I guess, can support or oppose legislation, but they were taking an opposition or voting in opposition to SIPACT in New York. So I know the New York board does not support it.
Okay, that's good to know.
Okay. All right, we're gonna go to item G, report on Children's Mental Health Strategic Plan Subcommittee activities, and we're gonna defer to
Dr. Stubblefield.
Dr. Stubblefield, and she is raising her hand here. Take it away, Doctor.
Good morning, Council. Thank you so much for the opportunity to serve and to represent BHEC and all of the member boards on the Children's Mental Health Strategic Plan Subcommittee. This subcommittee has been very active and busy at looking for solutions for the children of Texas. The subcommittee has subsequently divided itself into 5 work groups. Those work groups being governance, service array, family and youth voice, workforce, and then metrics and outcomes. The full committee met yesterday to hear the recommendations from those 5 work groups. I'm sorry, we began meeting yesterday. We had a meeting yesterday and heard from a part of the work groups. There's another meeting later today to hear from the subsequent work groups that had not yet reported. The writers for the actual report have begun working on the graphics and the report development. And they're feverishly working to have a draft plan, might not be by the end of this month, but early next month. We are on target with our proposed timeline. And after the draft plan for July through November would be review, revision, and approval through that committee process. The thing that I felt might be of note for BHEC and some of the other boards is there was some misinformation that kind of came out in that it was reported that the licensing boards did not support compacts. And I was able to share with this subcommittee the resolution that the LPC board adopted in September of 2022. There was also some confusion that it was the boards that were preventing counselors from joining compact. And so had a clarification there that this is actually related to a change needed in the occupations code that has to go through legislature. I do not know where this misinformation came from, but I'm doing what I can to make sure that individuals have the correct information so we can take the correct routes and would welcome any questions or comments for any information that I've shared so far, information that you feel needs to be shared on behalf of BHEC.
Could you repeat the work groups? I'm taking notes as we go. And
Yes,
I like
ma'am.
to organize that. So I got governance, service array, metrics, and then you said voices, but I missed the first part.
Yes, ma'am. So the first one, governance, service array, family and youth voice.
Got it.
We felt that was very necessary component for the children needs. Workforce.
That's what I missed.
And then metrics and outcomes. I actually am chairing that workforce subgroup. And that's where some of the information came out about the confusion with the compact and any relationship Texas might have with the counseling compact. And there's also a social work compact that's germinating out there as well. So
thank you. And I think that our different representatives from each member board could pass that along in a formal way to make sure that we're echoing what the work groups have and you have found. I appreciate it.
Thank you.
I can figure out this thing. There we go.
Have y'all had any reach out to like some of the major hospital systems, like Children's Dallas or in Austin, Houston, like some of the bigger hospital networks where you could really get a large umbrella over a lot of kids, where a lot of the children's hospitals I think would be like a great place where you could network and kind of get this thing moving too. I just was curious if you've had any connection there.
So I know that Service Array Group is working in terms of what services exist and where there are gaps and needing to fill some of those gaps. Is that answering the question that you're asking me?
Yeah, somewhat. I just wanted to kind of see what the outreach is like and how you're kind of, bridging this whole task force with the larger hospital systems where you'd have probably a lot of access, potentially even school systems. Just kind of thoughts. Again, I don't know all the logistics of exactly.
Certainly.
Just reading a few of the slides, but just kind of curious how that worked and how your outreach is working.
So I can speak from the workforce work group because that's where I've spent the bulk of my time. Is we pulled data in terms of like job openings at some of the LMHAs and hospitals and things like that, trying to see, if licensing boards are working so hard to license the professionals that we're doing and I don't have the data right in front of me, but last month, several hundred. Are there jobs out there for these individuals? And there are openings in all of the systems. There are openings in all of the LMHAs for kind of every level of professional and paraprofessional. And so in terms of the research that we've been doing, we've been looking at not on the service array part where there are gaps, but in the workforce team where I work, it's what jobs exist. And again, we have seen in the reports we've had is that all the systems have openings that need filling immediately.
Would you say that then that speaks to the shortage of mental health professionals needed for children's services in the state?
Yes, ma'am.
When we get to item 5, I'm hoping that you'll chime in once more if that's appropriate.
Yes, ma'am.
Thank you.
Dr. Stubblefield, this is Stephen. We appreciate your representation of BHEC and also on behalf of professional counseling. Is there anything that we can do to provide additional support for you?
I would suggest that the member boards who are supporting counseling compact or social work compacts, maybe we revise the resolution, at least with current dates. As I said, that was from 2022. I don't think any of the information has changed, but with a new legislative session coming in, just to have something with a more current date, the social work board can take that back to their board if they choose to. I don't know if anything at the BHEC level, I'll leave that to the council, in terms of anything you might choose.
Got it. Thank you.
Any other discussion? All right. I'm sorry, Chair Canseco, you mentioned something to come back to on item 5. I just want to make sure from my notes I don't overlook where you would like that discussion to be, perhaps.
And I'm not looking at the agenda because I'm a visual person. I like to see
That's okay.
everybody's action. But what I'm talking about is when we reach the ASPPB matter.
Oh, yeah, absolutely.
Is that item 5?
It is in item 5. It's
Okay.
probably G and H.
Good. I'm thinking of if there are openings everywhere, that means it's a demonstration of need.
Yep, absolutely.
Thank you.
Very good. So moving on to item H, Governor Abbott's April 18th letter to the Texas Higher Ed Coordinating Board regarding healthcare workforce shortages. I think this is not new. I think we all should have seen this already. Unless staff wants to chime in, I'll just describe this letter here. Essentially, it is restating from the highest level of our state government the recognition of the workforce shortage in healthcare professions of all types and stripes. And he's asking the Texas Higher Education Coordinating Board, which is essentially over all of our public universities here in Texas, to create a task force to provide opportunities and to remove barriers that exist to expand healthcare programs at institutions and provide students with the tools necessary to succeed in this field in Texas. And if that doesn't dovetail quite well with what we're going to talk about and what's motivating us to talk about EPPP2 and the barriers that we find there, I don't know what does. So anything else staff would like, or anyone else discussion on this?
Is that task force been appointed?
Don't know. I know that they've been in contact with our executive director and
Okay.
we've been coordinating with them. I don't know that the task force is up yet.
Okay.
I don't think they've been constituted yet, but one of the reasons why I wanted this included in the agenda materials is just to show you that they are not, the upper echelons of government are not letting off the gas pedal on this issue. It's not okay, we've said it, now we can move on. It keeps coming up and up again. It's going to keep coming up, and yeah, it's going to keep coming up. So it's not going to go away is kind of the reason I'm including it in here.
Should we provide them with any preemptive information or data that we have so that they are, they have information before them that enables them to act more quickly?
We are already working with the higher education coordinator.
Of course you are, Daryl.
Yeah, on several other projects on this.
Good.
And we kind of take the philosophy of we help sister agencies out whenever they get something that's kind of in our neck of the woods.
Wonderful.
So we are working with them on this kind of stuff.
Thank you. And again, many compliments to your team.
Very good. I don't know who has this item I, development of interactive maps reflecting licensee data.
I did that, Mr. Chair.
Good. I'm a real estate guy and I love maps because they're very instructive, truly, in terms of where people are, how needs are met and demands exist. So I love this and I can't wait to hear about it.
This was a project. Actually, Dr. Taylor had emailed me offline about this quite a while back. I can't remember how long ago, but he kind of asked me if we could do something like this. I certainly couldn't, but McGregor, that young man that's sitting off to your left over there that runs our IT, you guys need to, whatever young guys his age like to drink, y'all need to get him something nice. Because he kind of went to hell and back to get this thing done. And it's built now so that we can plug and play different kinds of data into it. He can make it look different. You don't have to use like a heat map like that. But, excuse me, this map is kind of something Dr. Taylor had asked about. But now that we have it, we can do so much more with these types of maps now that we have it. We just got to figure out how to use it. Excuse me.
If I
We
can
got to figure out how to use it and going forward. But anyway, we now have this capability. And I got to give credit to McGregor. He's the one that did it.
Good job, McGregor. I can say just by looking at this, it's obviously it looks very similar to a heat map of the population centers of Texas. There's 254 counties in Texas, and people live in all of them. And there's many counties here that we have no licensees. I would have to count it, but I mean, I don't know if it's a third or a majority. It's close to half. Have none.
Or under 5.
Yeah, or under 5, certainly.
Yeah, under 5. Yeah.
I think this highlights
that one right there in Big Bend National Park. They have a wide service area.
Yeah, yeah, they do. This is incredibly instructive.
Yeah. Thank you, McGregor.
And while this is up, just one other thought. I mean, when you think about the voices that we've heard from some of these smaller counties and how hard it is to get people and practitioners there, again, it highlights the importance and the intensity that we're going to have to fix it. So good job, McGregor, again. All right, moving on to action items. There's a couple things in here. Hang on, we're taking I'm looking at my agenda here. Are we doing the executive director as part of is it in here, or is that on another agenda item?
E.
Okay, so there's two things here. Both of those items, E and potentially H, are both items that we are able to go into executive session on. We definitely need to go into executive session for the evaluation of the executive director's job. On item H, I'll just lay out for everybody here in the public. I intend to move the matter regarding ASPPB and EPPP2. It is my intention to move to refer that matter to the Federal Trade Commission. We can go into executive session if we feel it necessary to debate or to figure out if we want legal advice on other options should the FTC not act on that. So we can either take that item now, or we will probably delay both of these items till later, just for the ease of the meeting, because we'll have to leave this room, go upstairs, go into executive session, reconvene, or the things that we don't have to go into executive session for to decide on, if we, especially the EPPP 2-1 with the FTC. If we don't feel the need to go into executive session for that, we could take that up now. So is there any consensus, or would anyone?
If I might chime in, I'd like to discuss this in open session. I think it's a matter of interest, not only to the professionals that we represent and the state that we represent, but frankly, to every jurisdiction that this matter has a stranglehold on. I understand that it's sensitive, but our members are professionals, and I think it's important that the public hear exactly what's at stake while we look at this. I hope I'm not being too bold.
No, and certainly I want to have, I think it's my intention certainly to have this conversation in public. The only thing that would be considered an executive session essentially is seeking legal advice for what are options should the FTC not act, or any other liabilities. Mr. Romig, would you expound? Anything you'd add to that?
And I guess what I would say is we could begin the discussion, begin G, go through as much, and at any point, should any member of the council desire to have legal counsel, we can then at that time move to H and move to closed session. And should no questions or concerns arise needing it, we can skip that agenda item.
Yeah, and we can still, again, when we go into executive session later and we just want to ask a question at that point, we most certainly can. But if it's not something that would color your decision-making on referring it to the FTC or not, there would be no need to do that now. Correct?
I'm going to have questions regarding it that I want to speak with legal about.
Okay, fair enough. Then we will delay. This is what we'll do.
But I think we're talking about a very broad discussion in the public in the public discussion, and that's very specific, narrow legal issues that I would want to discuss in executive.
Let's do this then, because we're gonna have lunch delivered a little bit later. I'm sorry, and Dr. Stubblefield, do you have a quick question? I acknowledge that.
Found some information that I think Chair Canseco is what you're looking for. One of the things we did is we requested some vacancy rates, and you're speaking specifically to psychologists with the and so this is as of May 31st, 2024. The vacancy rates for psychologists is 37.9%. You're on mute.
I'm sorry, what was the date again?
May 31st, 2024. And I'll send this to you.
So as of May 31, you're saying 37, almost 38% of psychology jobs are unfilled?
Correct.
Okay.
And what's the state of Texas growth rate? Does anybody know?
Large.
Sorry. A lot.
It should be in the strategic plan.
Yeah,
We
is that a lot by Texas standards or, you know, like little Rhode Island standards? I'm being facetious. Thank you.
In all seriousness, I mean, when you look at all empirically, when you look at all of our growth rates and you look at the growth rate of the profession, it is a game of attrition. We are not beating it. And we have to do so much better. Okay, so let's do this. Let's delay until time certain. We can go into lunch. We can do executive session upstairs, just for logistics. And then say it is almost 11 o'clock right now. Let's plan on, it'll be the first thing when we come back from that. So let's say 12:45. And if we're delayed, it would be like 1 o'clock. We'll revisit those two items. We'll just, we'll chop the two items being, I'm sorry, 3 items. Yeah. Let's go G, H, and the evaluation of the ED we'll do in closed session, but we'll delay G and H for discussion. 12:45, we get delayed 1 p.m.
Makes sense.
First thing after the break.
So
that way we can have the executives, any questions, seeking legal counsel. All of those questions will be answered and the whole conversation will be had in one tight place. Mm-hmm. Any other concerns or?
That makes sense.
Okay. So let's go ahead and dive right into 5, and we'll start with 5A, review and consideration of licensing and disciplinary recommendations from member boards. Recommendations are eligible for review regardless of whether they're listed in this document or have been made by a member board in an open meeting.
And we have two cases to review.
Okay.
The first one will be William Swope, which is a social worker who was convicted of a felony involving the use or threat of force. Under that, it falls under Chapter 108 of the Occupations Code, where it's a mandatory revocation of his license. This case went to SOA. They entered a default order since he failed to show up. The social work board reviewed this, and there's a recommended order that they approved and sent to the council recommending the adoption of it to revoke his license. I think we should just look and see Mr. Swope was given notice of this meeting. We should give him an opportunity to speak if he's present, but after that, if there's any questions about it, I'd be happy to answer.
All right, is the licensee present? If so, go ahead and raise your hand on the Zoom function.
Not up there.
Seeing none. Okay, is there discussion? Hearing no discussion. Is there any motions?
I would like to make a motion that we adopt the recommendation from SOA.
I'll second that.
Is there a second?
I'll second that.
Seconded by Dr. Cartwright. Is there any further discussion? Hearing none. All those in favor signify by saying aye.
Aye.
Opposed, say no. The ayes have it.
The next case for review is Jerry Huckabee. He's an LPC who was convicted of Medicaid fraud. This also went to SOA. It was a default order. And so LPC board reviewed this, recommended revocation. There's an order for the council's review and hopefully adoption. I think we should ask to see if Mr. Huckabee is present. He was given notice of this meeting, and also would recommend the order that's in the packet to adopt.
Very good. Is the licensee present? If you would go ahead and signify that by the raise hand function in Zoom.
Oh, that's right. Sorry. The recusal for Huckabee is Dr. Taylor, and I'm sorry, Mr. Swope was Brumley was needed to recuse.
Okay. Noting that there was all ayes and
no
no
one has
no's.
objected to it. Yeah.
The ayes still would have had it. Okay, Chair Canseco had her hand raised for a second. You good? You're on mute. Madam.
I think she was raising her
God
hand.
bless America. I thought I was voting.
Oh, okay, we're good. Okay, sorry. And the licensee,
Mr. Huckabee, will
raise your
raise his
hand. Seeing no hands raised on Zoom. Is there any discussion? Hearing no discussion, are there any motions?
I'd like to make a motion that we accept the recommendation from SOA.
Moved. Is there a second?
I'll second the motion.
Been moved. Are there any recusals on this?
I will recuse.
Taylor.
Okay. Any further discussion? Hearing none. All those in favor of the motion signify by saying aye.
Aye.
So Chair Belemowitz, I'd like to go back and recuse my vote from the Swopes
Okay.
incident.
Right, we're in the middle of the vote right now, so hang tight. All those opposed say no. The ayes have it.
Now I'd like to recuse from the previous vote on Swopes.
Do we need to read that?
There you go. Should we read that or?
Is any objections or does anyone wish to change their vote based on this recusal?
Hearing none. Okay.
Nope.
All right. Thank you very much. Okay, going on to the review and approval of the 2025-2029 strategic plan.
All right. So this was in your packet along with a survey results PowerPoint showing you the results of our customer service, our stakeholder survey related to strategic planning. And I'm happy to answer questions just briefly in sort of high levels. The feedback we received looking forward to the future, most of our licensees, the largest concerns and thoughts on their minds have to do with mobility, reciprocity in other states, telepractice, both internal to the state and out of the state, as well as financial concerns about reimbursements, concerns about insurance coverage. Many things that we as an agency do not have the purview over, but are certainly topics that have been among us and on our minds, as well as our licensees. Related to our operations, a lot of the feedback came down to referencing and recognizing great improvements that we have made in our administrative efforts, in our communication efforts. Lots of kudos for that, but still a strong desire to see even further improvements, availability of staff to answer questions, a point of contact, being able to get their questions answered, and then just general improvements in our website and accessibility as there always are. But so those are what fed our strategic planning efforts and the items that we have in the strategic plan, which is available on our website and has been submitted per the government code. Highlights of those ideas of things to work on, streamlining our licensing procedures as much as possible, finding a way to automate the checking of the National Practitioner Data Bank so that our licensees are not having to send in reports themselves, that would just be automated. Implementing a continuing education system, which is one of the items that we'll talk about here in just a little bit, that may come sooner than a 5-year strategic plan suggests. And implementing an ombudsman position for the agency, which again, I'll talk about that in our LAR request. Again, something we're going to try to act on quickly. So we really took the approach of thinking of the strategic plan in both long and short term, and identifying which goals we could begin acting on within this next year versus ones that may take longer.
Yeah. A saying that was told to me a long time ago is the question, how do you eat an elephant? And it's one bite at a time. And there's a lot of that in there, and appreciate the work that the staff did putting that together. All right, we need a motion to approve this. Is that correct?
That's
I'll
correct.
entertain that motion.
I so move.
Been moved. Is there a second?
Second.
All those in favor? Any discussion? All those in favor, if you guys could, when we vote, make sure you raise your hand nice and tall, and also take yourself off mute if you're as you vote. So all those in favor signify by saying aye.
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 Opposed, say no. The ayes have it. Thank you very much.
Staff, thank you for your work on this.
Indeed. Dovetailing probably quite nicely into that, review and approve the exceptional items for the LAR, legislative appropriations request. This is how the agency asks for the money needed to fund the agency. I think it's worth noting here that some agencies self-fund essentially through revenue that they generate through fees and whatnot. We do not. We send that money up to the general fund, and the legislature decides how much of that comes back. And it probably balances out sometimes. This year, I would imagine what we're asking for, it will not.
We, depending on the largest items, yes.
Yes.
We are one of many regulatory agencies that, yes, generally generate more revenue through our various fees and activities than the legislature appropriates back to us, which I know is a sore point for many folks, but that is how the legislature has traditionally funded many agencies. These exceptional items that we provided to you are obviously, as they're called, exceptional items. So we would be requesting the same budget that we've previously had, along with these additional items, and those would be considered separately by the legislature. The first one I will touch on and then skip over because we'll have a longer discussion about that, but is the development of a psychology licensure exam. If the council chooses to go down that path, this would need to be an exceptional item to receive funding dedicated to that purpose. But we'll talk about that more later. The other items generally relate to operations. The legislature sets the number of employees each agency may have, and that is based on an assessment of how many employees they need. We have been operating under that cap for many years. And in fact, up until this past couple of months, that cap was 68, 69 employees, and we are at 59. In an effort to right size, we have essentially given back 5 positions to the legislature, saying we do not need those FTEs. In exchange, what we were asking for is funding to fill the other 5, to actually come up to full staffing for the positions we need. Many of these positions have to do, two particularly are attorney positions. Back on those quarterly performance measures and enforcement data, you may have noted that the number of complaints pending at the agency is steadily growing, and the number resolved is not growing to match that point. Left unchecked, that is what ultimately creates a backlog, and we have all gone through that dark period of time and do not want to come back. And so where we've identified the slowness is we need more attorneys. There are more complaints and they can only handle so many, and so we need more. So that is item 2.
A good thing.
More
State that for the record again.
Always good.
Chair Hallbauer.
Lawyers are America's superheroes, and we need more of them.
The third item on the list is targeted salary increases. Now, the legislature last cycle made across the board salary increases for all state employees, and we are immensely grateful and want to recognize that. So out of respect, we are limiting our request just to the lowest paid employees at our agency, who the lowest employed 3 positions. We have not only are they the lowest paid at our agency, they are the lowest of all the regulatory agencies in Article 8. And all we are asking for, which we think is reasonable, is to bring them up to the next lowest agency so that they can get a raise and live in Austin, which is increasingly hard.
Yeah.
So
one thing I want to point out is I've had to go over to the legislature and sit in front of both committees in the Senate and the House on appropriations to figure out like we got to put a case for what are we doing with the money. And we have had a history, and we have Daryl to thank for this. We have had a history, a lot of state agencies start just burning money at the end of the fiscal year. I've seen Daryl let money go back at the end of the year because it's really nice to be able to go over to the legislature and say, we didn't need all this, here it is. But when we do need something, when we do ask for something, we mean it. And the legislature has, I think that's a great amount of trust that Daryl and this agency has earned with the legislature. And I appreciate the work that's gone into this here. The Chair Canseco.
I have a question about the lowest wage earners. Could you give us an example of what that is per hour?
Oh, I don't know the per hour, but they are several making under 40,000 a year.
I think that's a good thing to clarify. We're not just bumping big salaries bigger. This is taking care of, I don't know how you live in Austin for that.
Right.
At all.
Or anywhere really, but Austin, like certainly Austin.
Is it aligned with cost of living increases? Or does it, I'm wondering what, I'm definitely not arguing with it. What I'm thinking is it enough for those low wage earners? And as you know, I work with those folks every day and very aware of the cost of living, particularly for people who are at the lowest income levels in the state, if not the country. So I know that we have standards in the state of Texas. I'm wondering what that is. Could you, and this won't affect my vote in any way, but I would be curious to know, is it as low as $13 an hour or is it as high as 21? I don't do math in my head. I need Excel for that. So if you could just get back to me, it's certainly not going to affect my vote, but I would be interested in having that information.
Certainly, yeah. And we can put together a little cheat sheet of statistics and we'll go ahead and include not only hourly rate, but also a comparison for you of here's what our folks make versus similar agencies versus the average for that position.
That would be great.
And Chair Canseco, just quick math right there. 40,000 is about $19.25 an hour.
Good. Thank you.
What's
We're
the
not having people can do that in their heads. I think that's good. I just didn't want it to be at subsistence level. I appreciate that very much. Yes.
For the record, he used his phone. He didn't do it in his
I'm a cheater.
I was curious, how's the state health insurance for state employees?
The state health insurance is, this is sort of an opinion question, but I like it. I've had it all my career and I think it's a good.
Okay. I was just curious.
And what about retirement? Does the state offer retirement programs for our staff?
Yes, it is. That question is a complicated question based on when you started your year of service.
Sure.
And there are several of us who have earlier start date who have been here a little too long, have what's called a defined benefit plan. And so we have a traditional pension. New state employees, it's now a defined contribution plan. So more like a dedicated 401k.
Right. Good.
Robert, on the health insurance, is it actually fully covered by the state, or is it like sometimes they'll cover employee only and then spouse and
yeah, so it's employee. The premium is covered for the employees, but not for spouse and family.
Got it. Okay.
And it's elective.
Yes.
Right. Again, I'm looking at lower income folks, but we know that in the current economy, even middle income folks are struggling to make ends meet. But thanks, I appreciate that so much.
How big of a difference in retention rate do you have for those, let's say the 18 lowest paid employees, the ones that were asking for the increase versus everyone above that? Like, are we looking to make a significant difference in the retention rate between the bottom 18 and everyone else above, the 41 above?
I'm gonna defer to Daryl, who's on. I'm guessing the answer based on my experience is absolutely. The retention is worse for lower paid positions because those are folks who then particularly can find a similar position at another agency or frankly city or county positions that pay better.
Well, ideally, I'd like for y'all to say we believe that with these increases, we can reduce what currently is a 50% retention rate down to 20%, for example. Or Daryl, are you going to chime in on that?
Yeah, Chair Hallbauer, I don't know the exact percentages for what our turnover rates are right now. I want to say it was like a 17 or 18% turnover rate last time it was calculated, which is pretty high. Typically, we have been higher than the statewide average in the turnover rate. And it's almost always in those segmented employees that make under $40,000.
Sure.
One of the reasons we targeted that group is because in the last budget cycle, the legislature actually made additional appropriations for agencies with staff who made less than $40,000. For whatever reason, and I don't think it was intentional, I think it was just a look over, misstep. They left us out of that. And so our folks that made less than 40 didn't get that additional bump in addition to the 10% across the board. So that's kind of what we're trying to make up for here. We're trying to recapture that lost.
No, absolutely. You're going to lose people to other agencies that did receive that bump.
I'll tell you where this really, we've got a pretty good esprit de corps at BHEC. We've had a lot of people who leave and then realize, oh, the grass isn't greener over there. We liked it better over here. So they come back. We've got a good culture, a good work culture, and that tends to make up for a little bit of salary discrepancy between us. Now, that having been said, what I have found is it is incredibly difficult to replace people when they do leave. So have I been pretty good at keeping them so far? Yeah, we've been pretty good, but when you do lose them, it is incredibly difficult to find replacements who want to come to work for what we have to offer. And again, that's one of the reasons why we're asking for the money. But to answer your question directly, so that I'm not giving you a non-responsive answer, I don't know the turnover rates off the top of my head. Like I say, it was like a 17 or 18% turnover rate last time they calculated it.
Spoken like a true lawyer.
Well, and it's costly to retrain someone new. So retention is as critical as recruitment of someone new. And you definitely have a talented staff.
For the record, to the staff that's here, staff watching, we know that we give Daryl a lot of credit a lot of times, but we know that he doesn't do it all. And the staff from the top to the, I don't know who specifically, but to those, I don't know if they're watching, they know who they are. Like, we see them and appreciate the work that they do. And I appreciate the fact that this is in the LAR. I think this would be a good time to entertain a motion to, sorry.
There's just couple more items. I just want to make sure y'all are aware of, in case, just particularly so the public's aware.
Hey, I just want to tell you, Jenny sent me a message. She said $18.95 is the hourly rate that's the lowest.
Okay.
I'd love to see that become 20.
At least. Other items on here, particularly for the public's benefit, the creation of an ombudsman position. This idea would be to create somebody that is the point of contact for anyone who's having trouble navigating the administrative process. And so they could go directly to that person and get help, either filing a complaint, but more particularly focused on licensing matters, getting their application through, figuring out what's missing. Other agencies have had an ombudsman position with success.
Yeah, and the unfortunate thing is, like, it doesn't happen often, but people reach out to us as board members sometimes, like, hey, I'm having an issue, whatever. Like, so I know there's a need for that.
Yes,
I'm getting those calls, and it's not many of them. We certainly need it.
And so that the public knows, in addition, we're not just waiting for the money to get this position. We are working on our call system. We are working on the answering that you get and how things are directed, so that we're trying to make continuous improvement as that goes. And then the item 5, it is important to know about it. That is that National Practitioner Data Bank process where we get feedback on disciplinary actions that a licensee may have had in another state. Right now, statute requires us to check it every time someone renews a license. We are already doing that with initial licenses, but with renewals, we're only able to effectively do it with a percentage that get audited. But statute requires us to do it with everyone. The 2 options that we have identified, one would require the licensees themselves to pay for and send us a sheet, report every 2 years when they renew, and we would have 70,000 reports to go through, and quite frankly, we couldn't do that. The other option is instead to pay NPDB a fee per licensee, and they will notify us automatically anytime one of our licensees has an action. So that option is the difference between essentially a $4 increase or a $6 increase of cost per licensee. So it's a little tiny bit more expensive, but a lot less headache for everybody concerned. And so that's what we're asking the legislature for.
Yeah.
Robert, can you confirm for me? This is if they have an action that's outside of Texas, because I mean, obviously we would know if
yes
we provided an action, but
exactly.
So this is just if they're practicing in Delaware or somewhere. And
yes,
any get a complaint there.
Correct.
Okay.
Yeah, discussion.
Is this connected to the OIG? Is that would it be connected to that where it just kind of continually monitors that, and then it would notify you, or how would that work exactly?
It is similar to that. It's essentially like the fingerprint wrap back system or the OIG. It's the same kind of automatic notification system.
Okay.
But we would only act on it upon a renewal? Is that correct?
No, then we could, when we would receive, right now, we would only receive it to be able to act on it when renew happens.
Okay.
Doing this method, we would actually get it more timely and therefore be able to act on it immediately.
So what's the anticipated increase in responsibility based on just hearing about it immediately? I mean,
hopefully licensees are letting us know now as they are obligated to, and so we won't have a slew of information we didn't know about. But if we do, that's where those attorneys would come in handy.
We're gonna go get those attorneys. All right, thanks, guys.
All right, any other further question? Entertaining a motion to approve. Oh, sorry. I'm just ready to go here.
No, you're ready
to approve this thing.
I might suggest we delay the vote until after we have taken up the EPPP.
With that large item. Okay, that's fair. That's fair because we're asking for a sizable amount of money to create a new test as part of that.
We don't want to divide them up? Or
no, what I'm saying is that maybe we should vote on what we're doing on EPPP and whatnot before we vote to approve asking for $7 million.
Agreed.
That's one of the options.
Yeah, it's a lot of money, and candidly, that's a big part of the discussion in terms of the damages here of what we're talking about. Texas shouldn't have to spend that money, but it's where we find ourselves. All right, so we'll go ahead and table that vote for that item, and we'll come back to that pending further discussion. Okay, so this is moving to item D. Hang on, let me make a note here to come back to that. Okay. Item D, review of bids for compliance management for continuing education activities and a selection of vendor. I believe we had, I'm gonna embarrass myself if I'm wrong. I think it was 2. Is that correct? We have 2 responses. I'll turn to staff or Daryl to lay this out for the things that y'all think we ought to know.
Yeah, I guess in short, I'll start us off, and folks who know more can jump in and correct me. What we are looking for is an online platform so that our licensees can report their continuing education, and so that it makes it more seamless for us to receive that information and to do audits and to send that information out. We got 2 bids, one of which I've lost the name.
Can I just add one thing here, or clarify one thing? The bid request stipulated this was to be at no cost to the state. Is that correct?
Correct.
Only one of these responses is at no cost to the state, correct?
Exactly.
Okay. That makes it pretty clear to me.
Correct. And so that bid was from Ultratech, and I will answer any questions folks have, but that had almost $700,000 cost. So we did not look at that further. The bid from CE Broker is a no cost to the state, and in fact, there is a no cost option to licensees for them to register and go on and track this information. There are premium subscriptions that have more bells and whistles that the licensees could choose. We have folks present, I believe, from CE Broker that could speak more to the platform and all the bells and whistles that do come with it and what it can do, including a demonstration if anyone should desire. What we would be asking for is a vote from the council to authorize Mr. Spinks to engage in contract negotiations going down this road with them, with a conservative aim to implement by September 1st of 2025. We have some technical freezes to our database that we don't control. And so unless those loosen up and unless they give us more control, September 1st of next year is the best hopeful far end. Hopefully it'll be faster than that. But
very good. All right. So we want to hear from CE Broker. Is that right?
That is, if y'all would like to.
Yes. Yes. They would like to speak. Absolutely. Come on. And if you just state your name for the record.
Hi, good morning. My name is Kelly Parker. I'm the Senior Director of External Affairs and Government Relations for CE Broker. I have with me virtually the account executive, Amanda Lipinski, as well as one of our client success managers who can actually show the product if you all are interested in seeing it. But I just like to add that I'm a former Texas executive director myself. I worked in this building and I modernized continuing education management through CE Broker. I had rooms filled with paper, so I can speak from a unique perspective in saying I've been on both sides of that conversation and seen the benefit, and both to the agency as well as optimizing processes, as well as to the licensee and just giving them the tools for success and supporting their compliance and just making things completely simple. So happy to answer any questions here that you may have about it. I also know that the folks with me are able to show the product if you're interested in seeing it, but let me know where I can fill in any color text.
I'll defer to the board, but I would, unless I don't necessarily need to see it demonstrated.
Sure.
I appreciate the fact that there's a free option. I just would like to understand the commitment that y'all have to a free option. Because once we're going with a vendor, I wouldn't want to see the game changed or have that stifled. I understand that y'all have a business to run by providing value and there's a paid option, but can you just speak to the commitment that y'all's company has towards that free option should consumers not want to pay additional?
Sure. And I'll actually provide a little historical context as well. CE Broker's been around for over 20 years. We were actually born out of the Florida legislature back in 2002. The Florida legislature said all of the boards under the Department of Health need to modernize processes, and born was CE Broker. We've always been free. So fast forward 20-ish years, we've always been free to state government. That's actually in the contract that the board would sign, as well as that there was no services or costs for services for the state. And then as far as the subscription model, there's a $0 free basic account for licensees. They can do absolutely everything they need to do to stay compliant with their license for that. And just transparently, that is assuming that licensees, have one single state license. They understand requirements. They understand what's needed. They can do everything they need with that free version. The upgraded versions are voluntary subscriptions. It's more of a freemium model. The majority of our licensees today, which is millions at this point, because we work with over 250 boards in half of the US, the majority of our licensees, I think it's around 85%, have a free account. So the free account has always been there. It always will be there, but there will always remain an upgraded option for enhanced features, depending on that licensee, whether they need additional tools for success or maybe they're keeping up with multiple state licenses.
Cool. Thank you. You understand why that would be important if we got licensees saying you have to thing or whatever. So I appreciate you being so clear on that.
Yeah, absolutely. The one thing I'll add too, it's for the board itself, you're never going to be in a position to say you have to pay for it as well. So both sides, I think the board and both the licensee are covered with the free basic account as well as the free option for the state.
Good deal.
Other than the freemium buy-up, is there any other revenue source for CE Broker? Do you sell ads? Do you sell the CE?
So no, thanks for the question and happy to clarify. We do not create our own content and we don't approve our own content, but we do within our solution have what we call a learning module where associations, I know there's some associations in the room, associations or other board approved continuing education providers can host and link to content. In those situations, when those providers elect to have more of a marketing, like they want more awareness, we want to expand our reach, they can enter into revenue share agreements with us, but it's not required whatsoever for a continuing education provider to do that, to host on our platform.
So one of the things, as I read through your proposal, it talked about if an individual is audited, there's an automatic upgrade. Is that for a window of time that upgrade exists? And does the applicant have to request that upgrade? Is it automatic? Does the board request that upgrade? How does that work?
No, that's a great question. And a lot of times we forget to talk about that because we talk a lot about the free basic account. But anytime the board selects the audit pool, I'm assuming it's random based on profession, that random sampling, they would do all of that within CE Broker, notify the licensees through Broker that they were audited. And with that, they would be notified of their free upgraded account. It's called a professional account. That account actually provides a detailed transcript. For instance, if you have 24 hours, I'm just going to throw that out there, 24 hours for profession, and you have to report all 24 for the audit, it will break it down into categories. So for instance, human trafficking. If you need 2 hours of human trafficking, it will tell them where to upload it, how to upload it, if it's clinical, if it's didactic, if it's, self-learning, those sort of specifics, it will all be broken down, kind of a hard to fail audit piece to the puzzle, if you will. And the licensee will have that upgraded account for the entire period of the audit until the board or representative of the council says you have passed that audit, and then that would end that free upgraded experience.
Okay, thank you.
I'm sorry, I'm looking at my screen here. Is Faith Ray part of CE Broker?
I don't believe so.
Okay.
No, I have Amanda, I believe.
Somebody has a hand up on the Zoom thing. We're not taking a public comment right now.
I'll lower it, John.
Expanding on what you just answered regarding how the information that BHEC would be able to look at, you have it broken down by category topics, correct?
Yes.
Professional counseling divides up their CE hours by approved providers versus just everything else. So are the approved providers one of the category topics that you break it down by?
Well, that's a good question. I would say it depends on how it's broken down in your laws and so the one unique thing about CE Broker is everything is customized for each profession. So since the council oversees a number of, I'm sorry, I feel like I keep cutting out. If depending on what the rule says as far as required, that's the way it'll be broken down into the system. So without having that in front of me, if there were 2 buckets, then there'll be 2 buckets. It will match exactly what's required.
Well, would it be up to the specific therapist to say, like they enter their information and they say, this is one of the approved, and they put it in the category themselves so that then BHEC is able to retrieve that information? Or does CE broker receive the course and say, oh, okay, that goes into the approved category or the non-approved category?
So if we're talking about course content, and I'm going to call on my counterpart, Deb Carter, who works with our clients all the time, she might be able to add some color to this. But my understanding is if we're talking about approved content, again, it's customized to the board laws and rules. It's done a number of ways. It requires a licensee to select that provider sometimes.
Okay. Oh, well, yeah, I guess that's what I'm getting at. So the licensee, when they're entering that they took the course, they would say this is an approved course.
Right.
And then BHEC would be able to see, oh, okay, they did get their required number of hours from the approved list.
Yeah. So when licensees are uploading in our platform, licensees can either upload proof of completion or the providers can directly report completion for them. So if the licensees are uploading, we call them smart questions. And so there will be like a drop down situation where if it's APA, for instance, for psychology, if it's a approved provider or any other counselor, accreditor that's been approved, they can drop down from that list and the licensee would then select that approved provider. Okay. If you have a situation where a licensee is submitting something that is not approved that needs to go to the board or the council for approval, there is that option to route it that way as well. But it's the full, either scenario, there is a way for us to customize to do it based on what the profession needs.
Okay, thank you.
All right. Any further questions?
I do have one question. Just in terms of if somebody gets hours, let's just say they're at a conference and they get those hours in a conference, then are they going to be able to utilize the CE Broker platform to document those hours that weren't through CE Broker? And how, if they did take a course that's not CE Broker, would they be able to bring that over into the system? And that might be more of a question for our staff too, on how we kind of currently do it, and then merging them together if that case happened. I didn't know, like in that scenario, what that would look like and how that might present for the actual person completing and for our staff.
Sure, I'm happy to add some color, hopefully answer your question. So licensees can take courses from anywhere. It doesn't have to be connected to CE Broker. So it could be that annual weekend course that you go with your association. 2 things, licensees can either still get the independent certificates and upload them to your transcript in CE Broker for reporting to the board, or if that association works with CE Broker, they can upload a list of attendees that will automatically populate every single transcript for the attendees that were there at the conference. So 2 options there, but easy way to get any courses into CE Broker for reporting so long as they're approved by the board and the council.
That's great. Thank you.
Is CE Broker an app or an online sign-in program or both?
Both.
Both. Okay.
Yes.
All right. Any further questions, concerns, conversation? Okay, so we're looking for a motion to engage in contract discussions. Is that correct?
So moved.
All right, it's been moved by Chair Canseco. Is there a second?
I'll second.
And moved and seconded. Is there further discussion?
Are we discussing if we're going to go with CE Broker?
No, we're just, well, I mean, it's to enter into contract discussions to enter the contract
with the intention of going with CE Broker and entering a contract.
Yeah, and for clarity too, that between the 2 options that we have, one of them costs us, what did you say, 700 and change? Yeah, 700 grand, and the bid actually requires us to not spend anything. So
is there any merit having discussion on if we need to do this at all, or if there is value in having, are we essentially requiring all of our licensees to now have to use this program?
So we would be requiring everyone to use the program for the purpose of documenting their hours, keeping track of their hours. The problem that we are trying to address right now is there's not a very effective or efficient way for us to audit individual licensees, which we are required to do. We are to confirm that they, and so, right, it's, yeah, the best solution that we've been able to come up with, short of having our own system that would cost quite a lot of money to build.
For
And
example,
staff.
I'm a real estate broker. And so with real estate commission, the difference though is that we can only use approved providers.
Right.
We can't go do whatever. It has to be from one of the providers. They submit. Once it's completed, that automatically submits to the real estate commission, but it's all within its own ecosystem. And so unless we're ready to make our own ecosystem, this is our option.
No, I have no desire to make our own ecosystem. And I think the program looks great. It sounds wonderful. My question is this something that we really need to be doing? Is there a problem here other than we have to audit, and that's a bit of a challenge? I get that. But I mean, like, is there a real problem here? I don't think providers are, running amok, not doing their seat. This is causing like a huge problem for the state. So my question, doing this, are we forcing people into a program that some of them might not be able to access easily? Some of them might not be able to use. I mean, the fingerprinting, that happened. We all survived, but a lot of us had a whole lot of problem. Are we creating a barrier to the renewal process because somebody can't access the program or they can't get the stuff logged in? Are they going to be prevented from having their license renewed now? And is this going to hurt our 37% of psychologists that, jobs that are not staffed because now my license is held up? I want to be careful of something like that.
I feel it.
On the contrary, Chris, I think that what it introduces is efficiencies. I'm a recent learner of that lean management method about eliminating waste and increasing efficiency. I think as long as there's an option for folks who are struggling with this, and perhaps an ombudsman is that person, or there are opportunities within the, from the vendor for troubleshooting. And I'll look to our panelist. I'm sorry, it's not Ms. Lipinski, but I can't remember your name. I'm so sorry. I believe that we need to move with technology, and this sounds incredibly well thought out. So I don't believe that. I believe if there's an answer to someone who is struggling, who's not a digital native or comfortable with digital, this is the way the world's moving. It makes our agency more efficient, and I would imagine that extends to the users. And back to our panelist, whose name isn't in front of me. Have I missed something there?
I'm happy to provide extra context as well. During the 88th Texas legislative session, there were two bills, both endorsed by the Texas IT Caucus for continuing education modernization that would have required all healthcare boards, including mental and behavioral healthcare boards, to modernize continuing education services. Because nationwide, what we're seeing, to the chair's point, is that the top-down approach to modernization, it's all about fitting into what you were just discussing in your strategic plan with streamlining licensure processes. We're actually seeing, like in states like Georgia and recently that popped up in Indiana, they're talking about this more about reducing the red tape because it increases government transparency. A lot of times when licensees are doing the CE, they assume that they know what they need. And then when audit comes around, they submit their documents and they're like, oh, wait a minute, that's not approved, or I didn't know I needed that 2 hours of human trafficking. And so then it's ending up in a disciplinary action. And then you're, expending funds for that purpose and opening a case that you don't need. So this is about streamlining the process through agency modernization, both optimizing processes for the board, but then again, meeting the licensees where they are. I think I'll stop there and say these days it's more, that push to turn government digital services and more to like the Amazon experience and having what they need in front of them, increasing that transparency. So it's actually been proven to help in what we've seen across.
Yeah, and I love all that. And for the record, I am a lover of efficiency and technology. So I love those things very, very much. I just want to ask that question of once we go down this road, we're essentially forcing 75,000 individuals into using a software, and I really don't know that there's a whole lot of going back at that point. Going to be, there's going to be some chaos there, and we're talking about 5%, right? We only audit 5% a year. So my question is, do we have the potential of causing more chaos by forcing them into a system that's supposed to be more efficient?
Can we hear about the workload of staff on what we're doing?
We do have Ms. Lipinski's, I think, ready to respond to part of that, and Mr. Spinks is also wanting to.
Oh, sorry. I see some hands raised here. Sorry. Y'all yell at me.
Yes. Thank you. I wasn't sure if I could speak. Thank you. I'm Amanda Lipinski, as Kelly mentioned. I'm with CE Broker as well. Wanted to address one of the comments there. The ultimate goal of our solution is to actually unburden the licensee and make the entire renewal and CE journey a lot easier for them, not the opposite, so to speak. One thing I wanted to call out along those lines, which was in the response, is we offer licensee support, which is very rare. No other company that I really know out there does that. And the goal is to act as an extension of the board. So when you get those calls of, well, what else do I need? My renewal is coming up, and they haven't been tracking that. They have resources to track it already, and as well as multi-state, and they can contact us. We have a knowledge center, FAQ, different knowledge bases, tutorials to help them not only learn and adopt the system, but as they're submitting CEs, as they're maybe responding to an audit. We also have chat and email support 8x8 Eastern, 5 days a week. Again, the whole goal there to support the licensee, make that transition easier and the whole experience a lot easier as well. So wanted to chime in with that.
And so we're not looking at chaos. What we're looking at is change management.
Yeah.
And particularly, I imagine Daryl's going to highlight what I'm about to say is we have one staff
right
for this function,
Yeah.
for all renewals.
You said
And
how many?
One.
You have one person.
Who handles renewals. And so she cannot provide
that level of customer service.
Service.
Yeah.
One person for 85,000 licenses.
Yeah.
Wow. I will say, just wrapping up, especially in those cases, we see a lot of one staff, two staff. It helps maximize what they can do so they can really focus on those high impact tasks, and we can help alleviate and solve for the other pieces. Yeah.
This is a matter of outsourcing the things we can and keeping the things we need to keep. Daryl, did you have more?
One thing I would add is kind of the question about why are we doing it? The bills that Ms. Parker talked about earlier, they didn't pass the legislature, but Senator Blanco and Representative Cook did send all the agencies letters after that saying, look, this issue, y'all need to be looking at this, even though these bills didn't pass. And I think I shared those letters with you in the past, but basically they were like, we want you to try to implement this under the same provisions as our bill. Now, to be honest with you, to our credit, we were already looking at this before the legislature even started looking at it. We started this journey a long time ago. So, kind of kudos to us on that, but we're just a little slower than everybody else, I guess. But anyway, I'm just saying that legislators have asked all agencies to do this, try to gain the efficiencies that these types of services would provide. And as we grow, we're not going to be able to keep up with. We're going to have to figure out something because one staff person can't do all this. You start having to cut corners to keep up with things, and that's just where you're going to get in trouble in Sunset and with auditors and just with the public in general. You're not going to do your job. So we've got to be thinking about how can we leverage more resources out of the same type of budget that we've got. So anyway, I'll shut up now.
No, I think that my concern was that we're not adding an additional burden to licensees. It's certainly not an additional cost. We've spent way too much energy and time on reducing costs to just willy-nilly add something on. And I'm more than satisfied that we're not doing it. We're not adding on cost.
I very much agree.
So.
My last question really, Daryl, is are we able to structure the contract in such a way that they only have to utilize the broker system during the audit process, like they don't have to use it if they don't want to, if they're not being audited that term.
Basically make it a voluntary participation.
Right, until you're audited, and then we just use it as this is where you go to upload your stuff. They can use it if they want to, whenever they want.
Yeah.
Maybe, but that becomes very complicated on the database side of it. Because if we do the guys, my voice is just about shot. I'm sorry.
I think what Daryl's trying to get to is
Yeah.
he doesn't want to have two systems and then flipping between. It's kind of a one track, like this is the way, and it's a more
No,
streamlined.
it would be
approach.
one. It would just be that, but they don't have to have an account. Basically, I don't have to make an account until I'm audited.
Well, but that's how they're uploading them regularly. So that's how they would do it. Like,
Yeah, I mean, maybe I like to keep all my CEs crumpled up in my desk. And if I get audited, and I like to go and scan them one by one, you know?
We can certainly explore it. One thing I will say is a longer term benefit that wouldn't help is I believe that a function of CE broker, y'all can correct me if I'm wrong, but is as things are uploaded and as there is activity, that can actually help inform who is selected for an audit. You know, it can be 5% random, but then it can also be alerting, you know, that if there is ultimately I think best goal would be the system can just flag for the licensee themselves, you're missing something this year. Go get it before, and then you don't even need audits because everybody just knows they're in compliance.
And overall, I feel like that defeats a beneficial purpose to our licensees, and that's what we're constituted to.
Sorry, Ms. Smith,
do.
you hand raised.
Thank you very much. I apologize if you guys already asked this question. I had to step away for a couple of minutes. What other licensees utilize a system like this? How do doctors do their CEs, nurses,
lawyers,
attorneys? Do they use a system like this as well?
Yes, attorneys, lots of professions in Texas, and as CE broker I stepped on you, but you were about to say
No, I was going to say
250,000.
Yeah, the Bar Association in Texas has a very similar service, not CE broker, but the same requirement. We also recently contracted with the Texas Medical Board, which is 170,000 professionals, 102,000 physicians. We have the Texas Funeral Commission, as well as the Texas Optometry Board, and Texas TLR, which regulates close to 1 million professionals, you know, put in their RFP for a new licensure system, probably 50 requirements for a CE management system. So when they're looking new and looking to upgrade, they're looking to do it here in Texas, but nationwide, we work with 250 boards, I think around 23 mental behavioral health, and some of those are combination boards similar to the council, meaning that they regulate LMFTs as well as counselors as well as social workers.
Did you say you're
Thank
looking?
you for.
I'm sorry.
Thank you for that information. Hang on just a second. Thank you for the information. So basically, we would just be asking our professionals to go to the same level as other professions do. Okay. Thank you so much.
I'd like to call the question.
Hang on, just if Chair can say, go. I have one further question. You said TLR, y'all are looking at doing something with them.
Well, I'd say that in the RFP process, they added a CE management component to that RFP process. So we're hoping to be a partner to TLR, but still there's a process, just the same as there was a process here.
That sounds good. I'll just say for the board, I'm also licensed by TDLR as a property tax professional, and our CE process is terrible. And I would welcome something like this. I lost the paper form that they sent me, and they call. And then I gave up and I emailed them, and 2 days later, and I felt bad because I made some staffer at TDLR go find my renewal paperwork to send me that I've got to get postmarked before the end of the month. So completely cumbersome.
What's the price tag if we built our own system? Did we? I mean, for the public, no one saw our staff's eyes get really big. No, I'm just saying, are we looking at it going this direction saves us a hypothetical $1.5 million as opposed to building our own system, which is what the lawyers have. I mean, we log in and
You know, from Ultratech, they're offering 700,000. So that's a good starting point right there.
All right. So it streamlines staff responsibilities. It saves hypothetically 1.5 million. So
Again, I'd like to call the question.
Yes, ma'am. The chair is calling the question. Any further discussion? Hearing none. All those in favor, sorry, the motion on the floor was to engage in contract negotiations to pursue a contract. It's been moved and seconded. All those in favor signify by saying aye.
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 Opposed, say no. The ayes have it. Okay. Yes. All right. It is 11:50. Let's do this. We're going to go into executive session, and there will be a recess between that, obviously, between now and us gaveling in an executive session upstairs. Let's come back. Let's plan on coming back.
If we go into executive session, yes.
What's that?
If you're going into it, you just need to make sure.
Yeah, I will. I'm just trying to think on timing. Do you guys think we'll have two things really to discuss? Legal advice regarding EPP2 and Daryl's, Mr. Spink's, words are escaping me. Evaluation. Thank you.
He didn't even show up for it today.
I know. Slacker. No, we appreciate you being here virtually, Daryl, giving this and even putting on a tie for us. Thank you. 12:45, is that good? Do you think we can hammer through all that? Or should we say 1 to come back? All right, 12:45.
Even a no earlier than, right?
Yeah, no earlier than 12:45.
That gives us flexibility.
That's right.
To take longer.
So no earlier than 12:45, we'll be back into open sessions. I'm going to go ahead and take us out of this. The Executive Council will go into a closed session at this time pursuant to the Texas Open Meetings Act on agenda item number 5E, evaluation of the executive director's job performance together with any personnel action warranted following the evaluation, to consider personnel matters under Section 551.074 of the Government Code, and on agenda item number 5H, discussion concerning potential liability together with the legal and administrative remedies available to the agency if it is required to adopt the EPP2 in order to continue using the EPP1, to seek advice of its attorney about pending or contemplated litigation under Section 551.071 of the Government Code. The date is June 25th. 2024, and I will get the time correct this time. It is 11:52 a.m. To all members of the public in attendance, you may stay logged into this Zoom meeting, and the council members will leave. And once the council is closed, session is finished, the council will rejoin this Zoom meeting. Again, we expect no earlier than 12:45. All members of the public that are physical in attendance in this room. Actually, we're going to go upstairs.
Yeah, they can
So y'all can stay here if you'd like to. We'll be back no earlier than 12:45. So we stand not adjourned.
In recess.
In recess. Thank you.
I'm gonna need this when we get back.
Yep. All right, the time is 1:20 and we are back in session. The Texas Behavioral Health Executive Council. Sorry for that delay. I know we said we were shooting to be back no later than 1. I did say that we were going to take items G and H first thing back from the break. So sticking to that, we're going to go with items G and H. G is discussion about the Texas State Board of Examiners of Psychologists request for agency action regarding the creation of a new alternative to EPP2 based on the mandate from ASPPB. And H is the discussion concerning liability in conjunction with potential legal and administrative remedies available to the Behavioral Health Executive Council regarding ASPP's mandate to either adopt EPP2 or lose access to EPP1. Just one other housekeeping item from our executive session on item E, evaluation of the executive director's job performance. We are taking no action on that. So moving on to item G and H.
Should we just publicly real quick, just say, Daryl, you're doing a great job. Thank you
Yes.
so much for all your hard work. We really appreciate you, and what you've done is nothing short of Herculean.
Second. Thank you, Daryl. So laying out the action that I said that I'd be doing, I plan on moving to send this matter to the FTC because I do believe that ASPPB is subject to the Sherman and Clayton Acts. They came here and spoke with us. I'm very grateful that they came and spoke to us, but they contended that they are not subject to that. I believe they are. I don't know what grounds a nonprofit would have to say that they're not liable or not subject to the Sherman and Clayton Acts. I don't know how they're not a monopoly. They're the only test like theirs that exists in the country. I guess the world for that matter. And I don't know if that's necessarily illegal, but when you use that position to exploit for gain, essentially increasing costs, increasing barriers to a profession, and with the tying arrangement, it gives me great concern. So with that, I'm going to turn it over to Dr. Cartwright to lay it out from the psychology board perspective. And as the psychologist on the board, no better person to do that than Dr. Cartwright. So Dr. Cartwright, you have the floor.
Thanks, John. So I'd like to give everyone, including this board and members of the public, an overview of the current EPPP 2 mandate situation. Basically, a brief background of the EPPP 1 and 2, some of the big issues revolving around implementation, and then the impact that could have, as well as some future discussions and questions floating around out there that I know a lot of people are wondering about. So first, I would like to say thank you to all the members of the Psych Board and BHEC for their hard work on this issue. Also, our attorneys, staff, and Ms. Canseco for your comments that you made at the last Psych Board meeting. Those were well thought out and we well appreciated. So as most of you know, we currently have a mandate to reduce barriers for entry in the profession of psychology and the other behavioral health fields in Texas. Barriers of entry into the profession impact our providers serving rural areas and urban areas, psychologists of color, and those with practice differences that could serve our high Hispanic population in the state. To fill you in, there was not a debate about the EPPP mandate, but rather it was more of an executive decision by the board of directors in the October 2022 ASPPB annual meeting. So as a board, we've been trying to openly discuss the challenges facing Texas with this new mandate, but also other states are struggling with the same issue, including, some to mention a few: Florida, New York, Alabama, I know for sure are. But by adding an EPPP Part 2 exam, we seem to be going the opposite direction and could be potentially restraining trade and creating a barrier to entry into the profession. Currently, there is no alternative to the current exam for EPPP Part 1, and we are mandated by the legislature to have an exam for licensure, which we all agree with and believe is needed as a unified board. We believe we need an exam. The mandate is starting January 2026, that all licensees will need to pass both Part 1 and Part 2 of the EPPP. But this will be in 66 jurisdictions across Canada and the US for all licensees. So just to fill you in a little bit on the ASPPB and the EPPP itself. So they assert that they've created Part 2 to protect the public, and while it was launched in 2021 in a few jurisdictions, Texas has only used the EPPP Part 1 by itself since the oral exam was removed after the Sunset Commission. I believe that was in 2019, but correct me if I'm wrong.
I think it was 2017. We got rid of it.
2017?
Yes,
okay,
sir.
My apologies.
No, you're good.
No data has shown that there is a higher disciplinary action since the oral exam was removed in Texas after Sunset, which leads to the point, where is the necessity for this? So to be clear, Part 1 and Part 2 will be mandated by all jurisdictions starting in January of 2026. ASPP asserts that Part 2 measures skills and competency to practice, while Part 1 is designed to measure knowledge, and together would be a competency-based licensure exam. There's no doubt they've put a lot of time, a lot of money, a lot of effort into this. We understand that. And we're not saying the exam is a bad exam, but there's 500 new applicants for licensure in Texas, likely within any given 1 year, that would now be mandated to take 1 and 2. Whereas right now, currently, there's only 6 jurisdictions that are utilizing the EPPP Part 2, and that's only 300 applicants within those per year, technically on average, for those 6 jurisdictions. It's only 300 applicants, which is far less than what just Texas alone would be dealing with. So time frame is a big issue here, as you know, we've discussed. There's just not a lot of time, and jurisdictional coordination is difficult in Texas with such a short timeline. January 2026 is 18 months away. So in the April TSBAT meeting, I actually asked in the Q&A panel if we could have wiggle room to negotiate the implementation date. And then Dr. Lambden followed by asking for a rollout of 2028 January rather than 2026. And a motion was to be made at that mid-year meeting. But we recently just received a town hall letter on June 17th, 8 days ago, that stated ASPP Board of Directors are reaffirming the Part 1 and 2 rollout for January 1st, 2026. So no extension that we've been told. They also added that Part 1 and Part 2 could be taken within 30 days of one another, but this doesn't help our problem in Texas whatsoever. It just allows both parts to be taken closer together. Does not solve our problem at all. So really, then, you know, we need to think about what is the impact related to cost and actually passing and getting licensed psychologists in Texas. So just a couple little data points. According to ASPPB's own data, the national passage rates for first-time test takers from APA or accredited programs were 73% for Part 1 and 69% for Part 2. However, candidates from non-accredited programs have passage rates of 64% for Part 1 and then 41% for Part 2. So significantly lower than even Part 1 and with the non-accredited folks. So again, pass rates are not good, and I'd say they're fair at best for Part 1, but then the combination of taking both and passing both will make it even more difficult to obtain licensure. This barrier means roughly a third of those applicants won't be able to pass first time, then pay another $450 to take the exam again. Just a quick thing on cost, quick couple points. So right now, just to fill everybody, EPPP1 costs $600, and it has been that way since 2013. The EPPP2 was supposed to be reduced to $450, which I assume is still happening, but you have to also remember sample exams. So that's $1,050 total there. You have to keep in mind sample exams, and to take the test in a Pearson Center is another $83. So anytime either of those are failed, they need to be retaken at that same rate. And with pass rates, you know, with fail rates as high as they are, you're talking about there's a lot of dollars there. So again, time frame issues are huge here, and having an exam is a statutory requirement by our legislature. So Mr. Bridges made a motion in our April meeting to go ahead and begin the process for information gathering and to take it up to BHEC and to exploring the creation of a new exam. But keep in mind, there is only one legislative session between now and 2026, and this would indeed be a large addition to the LAR legislative appropriations request. So even if we were to implement EPPP1 and 2, we couldn't get it through all of our regulatory burdens. And even if we are to do what they ask us to do, we couldn't even meet the timeline they have laid out. Regardless if we're on board or not, we need to do an analysis of what it will take for us to adopt Part 2 and the amount of lead time to train institutions on how to implement Part 1 and then Part 2 in the manner that is recommended by ASPPB. That would also take a considerable amount of time, effort, and coordination. So for the annual ASPPB convention that's going to be in November of 2024 in Dallas, I'll be at that convention. I did ask, I'm on the planning committee, and I did ask for them to add the EPPP2 challenges facing jurisdictions and the rollout of the exam. And they have stated that they will add that to the agenda and that will be something discussed in the convention. So that's a positive for open communication about this and allowing other states to chime in too about their concerns and difficulties they're having. Another issue, you know, and I'll probably let the attorneys talk more about this area and maybe John, but just the whole anti-competitive. I mean, ASPB asserts that it is one exam, 2 parts. However, you know, 2 separate dates, 2 separate fees, separate study materials, separate scores. You know, it sort of seems as if it is really 2 tests. You know, I think a lot of folks have thought if there was a way to consolidate this into 1 test at 1 sitting for 1 fee, that would be, you know, much better, which would, you know, we think that would be a good way to, something to at least look at or for future discussion. But, you know, just a couple of other quick discussion items I think that have arisen. Just again, you know, people are very concerned about, you know, PSYPACT portability. Will licensees in Texas still be allowed to take EPPP Part 1 and 2? And, you what happens to folks on January 2nd, 2026 that are trying to get licensed? There's just a lot of confusion, a lot of muddy water. Everyone's scratching their heads, and there's worry out there right now, genuine worry from psychologists in Texas of what's going to happen, and licensees trying to get licensed in the state. Again, we tried to ask for a later rollout, so we would have more time to figure this all out, but that was denied. So at this point, there are a lot of questions about portability. Can folks come in if they've taken? What about Texans that if we had our own exam and we're taking our own exam, what if they needed to go to another state at some point in their life? So again, allowing the ability to still have access to 1 and 2 if possible are things that we've just been on the table to talk about. But that's essentially the other thing too is if we were to create a test, would other states be able to take the test that Texas would create if we did do that? But those are just the different discussion points. So I know I took a lot of time there to explain that, but just wanted to kind of give you kind of a timeline and give you somewhat of an overview of where things sort of stand now on the psych board and where we are today. So thank you.
Dr. Cartwright, that was an amazing amalgam of so many arguments I've heard from individual board members that you put together perfectly. So thank you for that. Thank you for that very much. Questions from the board? Concerns?
Talking about funding.
Ms. Pryor had her hand up.
I just had one quick question. And again, I'm a public member. Currently, only the part 1 is required. So
Yes.
if they're certified under the first one already and they're practicing, and this part 2 goes into effect, will they then be mandated by that January date to take that or lose their licensing? I just didn't understand that. If you could just clarify that.
You're asking.
Am I making sense?
I think so. You're asking what happens to them if they're in the process of getting licensed and they're not licensed prior to January 1, 2026, and they've taken them past part 1?
Yes, that's what I was asking.
I thought she was asking.
So,
And if they, because part 2 isn't currently required, is it?
So are you talking about currently licensed psychologists or new people?
Yes. Current people.
No, current psychologists would be they're grandfathered. They're licensed.
They're grandfathered.
This would
Okay.
only be for new applicants.
right.
Thank
We'd
you.
have to figure out something though, if somebody was in the process. No, I think if they sat for it prior
So
to.
if someone had already applied and sat for the exam before January 1st, 2026, then that should be fine. It could be that there would be someone who has submitted their application materials to be authorized to sit for the exam before January 1st, but does not sit for the exam until after that, and they would probably have to take both. And it does raise the question of anyone who is currently licensed in the state and then wants to apply for a license in a different state. They might need to then go back and take the part 2, depending on that state's rules.
Like if we had reciprocity with a state,
They would
would
not have to.
Yeah, but
if that state requires both tests and have not put in any sort of exemption for grandfathering folks, then those people would have to go back and take the test.
I hadn't even thought of that angle.
I actually hadn't either. I'm glad you brought that up.
Ms. Canseco.
Yes. A couple of things that I want to emphasize from my perspective. I'd first like to thank the Psychology Board for inviting me to speak and allowing me a few more than 3 minutes. I particularly appreciate the wisdom of each individual board member. I was so impressed with how each member voiced a different set of objections. And are you 7 members, John, or 9?
We are 9. Think about that for a second.
9 different psychologists came at this issue with the same conclusion for 9 different reasons. And I consider them experts in their field, obviously, and with a wide scope of knowledge from everything from private practice to the big issues in mental health today. There are 3 points that I'd like for our listeners to attend to in particular, in addition to what Dr. Cartwright outlined. My first is that this test is vendor mandated, not need-based. The second is test costing. While Dr. Cartwright outlined the costs of taking a test, taking a second test, retaking a test, potentially taking, like the Princeton review kinds of things, the time and then the cost, the efficiency during a time when there's no need demonstrated, does not take into consideration the average tuition for postgrad work for psychologists is $182,000 the last time I looked. That doesn't take into account undergrad tuition or student loans. It doesn't take into account the cost of living overall, whether you're in school part-time or full-time. That presents a financial barrier. And finally, these barriers are being introduced during a time when Texas and potentially many other areas of the country are facing provider shortages. At a time when Texas in particular is experiencing high population growth. And at a time when the stigma for seeking care for the general public is being reduced overall. Folks are accepting the roles of seeking mental health and how important that is just to daily living. This is not only not good for our state, it's not good for our country. And I'm afraid that I am not as gracious as Mr. Belemowitz and others in that I don't feel capable of extending the same grace that others have to ASPPB et al. I believe that our role is to protect our stakeholders, to ensure an anti-competitive environment, and first and foremost, to make certain that our providers are recognized for the expertise that they have shown and for how this has grown in our state. So bravo to all of you who are helping us work through this, and to our stakeholders. I hope you'll make some noise. That's what it's going to take. Thank you.
Thank you, Madam Chair. Sir.
Well said, Madam Chair. Thank you. Just to educate, because I'm not very familiar with this, obviously. What is their reasoning? What's their intent? Why do they feel like we need this new test?
I'm going to do my best to, and Dr. Cartwright, feel free to chime in on this too and help me out. I'm going to try to take this as objectively as possible to regurgitate their argument, which it's hard to do because I disagree with most of their argument. But their argument would be that we asked for this. That's one of the first things that I've heard, that the agencies asked for this. And that's not entirely false, but it's not true. Back when we got rid of the oral exams, there was a concern within the profession of, oh my gosh, like the guardrails are off, the sky is going to fall, we're going to have all these unqualified people come out, we need some sort of skills test, because the oral exam was that test. Daryl may be able to chime in and explain the delay. There was a lot they wanted to mandate it. There was an outcry at that point. ASPPB relented and did not impose it then. And everybody was kind of cool. We knew that it was in the background and still happening or still developing. The mandate that Dr. Cartwright explained in 2022, when that happened at the national exam in Maryland, the national meeting in Maryland, we were there. We didn't know it was coming. I was in the room. They announced it. My phone, Daryl was like, I didn't know this was coming. And I was like, they just looked at my phone, they blasted it to the whole world. Conveniently timed, the email went out timed as they were announcing it to us in the room. So it felt very premeditated on their part. And part of the problem with this, though, is that ASPPB doesn't work like we do. This is an open meeting. We have to post it. We have these conversations for the whole world to see. ASPPB does not, and many of their meetings are actually closed. And there's not recordings of it. Like, it's incredibly difficult if I wanted to, even as a member of ASPPB, as the chair of as a member state, I'm very limited on what I can get, which that kind of lack of transparency is problematic. Their argument, though, there's a long-winded, lot of context to your answer. Their answer, I think, would be that we asked for this and that we need a skills test. There's other, the medical profession is going this way, which to me, again, doesn't speak to the actual need. There's a need for a test. Tell me the need for the test. Show me where in this state we have a bunch of unqualified new psychologists. No one's been able to show them to us yet. So that's their argument. I feel like they have not been able, chose to, or not been able to answer the main question that we would need to be able to answer is why? Why do we need this?
Thank you.
Any other questions?
I'd agree with everything you said, John.
All right. Well, thank you. I'm gonna go ahead and move then. I'm gonna recognize myself for a motion. I move to refer the matter of the EPPP2 mandate with ASPPB. I move to refer it to the Federal Trade Commission for potential violations of the Sherman and Clayton Act.
Chair, I will second your motion.
Sure thing. It's been moved and seconded by Chair Canseco. Any further discussion? Hearing none. All those in favor signify by saying aye.
Aye.
Aye. Aye.
All opposed say no. The ayes have it. Thank you very much.
I remember to sit
Mr.
further away from you.
Sorry.
Mr. Presiding Officer.
Yes.
Fit as an addendum, could I briefly lay out the possible options for pursuing an exam?
Yes, that would be,
would like to get some direction from the council.
yeah, that would be, item, G, that would be perfect. So let's talk about that. Go ahead and lay it out for us.
So in your packet, I'll share it up on the screen. We provided a sort of rundown of the steps that it would take to develop your own exam, sort of the universal steps that it's necessary that if anybody's developing an exam. And in short, it's you need to decide what are you testing for, then have experts develop the questions, and then have separate experts validate those questions and decide they're correct, and then conduct sample testing and pilot testing to then validate that it is a good exam and then roll it out. Now, as Dr. Cartwright said, the focus on timing is the big one, meeting that January 1st, 2026 goal. Now, we really racked our brain to think about is there an option that we could have a test ready by January 1st, 2026? The problem with that is that we do not have any funding currently authorized by the legislature to do that. So this option 3 that you have is the only way we could think of as possible. And I'll go ahead and say right now, we don't think it's very likely, but it would be essentially the CE broker model, the same kind of thing of finding a private company that is willing to front the costs and create the exam with the understanding that it does not cost us anything, and they would then be getting the proceeds from the exam fee to pay for it. You lose a lot of control that way, and we wouldn't be able to be sure what the cost for the applicants would be necessarily, because that company would need to make up the cost. And so it is the only option that would get you there by January 1st, 2026. So I wanted to offer that, but it's not what we recommend. The other option, really option 1 and 2, break down between how much of the development and work will be done in-house versus out of house. And going in reverse order, option 2 is really the stem to stern done by an outside company. The benefits of that model is it's less rushed in development. We're really just saying, hey, there are these testing companies out there that this is their job, and we will get a large amount of money because it is the most costly option, and give that money to the company and say, please do all of the legwork that is necessary. Consult with our stakeholders, consult with us, but you would run the meetings, the company would run the meetings, the company would run the test development, they would ensure all the steps happen. And at the end of it all, come back to us with a test. That's the least amount of work for us, but it is the most costly option and gives us still a little less control over what comes out, because the company's going to have their process. They're going to have, so we'd have to fit into what their process is. Option 1 is a bit of a hybrid between those two, which is to keep as much control in-house as possible by getting appropriation from the legislature to have exam-focused staff that would be doing what would be really considered the project management side of the development. We would still not be the ones developing the test questions ourselves. We would need to get psychologists and subject matter experts to do that. But we would have staff that would facilitate that whole process. And then what we would need to contract for is essentially the validation side, where we have a company that is advising us throughout the development of the exam, and then doing the psychometrics and the analysis to make sure it's correct. That should definitely be cheaper than option 2, and it is possibly faster than option 2, because we can at least start now somewhat, because our staff can start the initial legwork. It is more work. It's more work on us, but it gives us the greatest amount of control, and frankly, we think a much more quality product at the end of the day. So benefits and drawbacks to each of these options. Happy to answer any questions you might have.
I see option 3 as a non-starter. I don't see, I mean, seating, it's sort of trading one for another. We have no control over our exam right now, and it's not going very well for us, and seating it to a private company, that's just trading.
I agree with that. I don't think we can do 3. There's no way.
So between 1 and 2, though, the first option smells a lot like when we started this conversation, everyone was, and not wrongly, was very concerned. Do you understand what you're signing up for? Do you understand the Herculean task that you're thinking about? Option 1 smells a lot like that. And that's concerning, because as an agency, like, we've got a lot of things that we're trying to do and requires additional agency staff. Like, from where, and do we have the budget to do that now?
And we would need more positions from the legislature.
Yeah.
I will say part of why we feel better about this option, we're still a little nervous because we're smart enough to be nervous.
Yeah, good.
But we have had a good conversation, and let me do my grid. Daryl, is it okay if, since you're on, can I share the conversation we've had with the folks across the way? You're muted, but I think you're nodding. Okay. We've had a good conversation with folks at UT that have an educational psychology department that does exam development. And so once we found that out, that they have a department that does this, they've actually been very instrumental in helping us understand what the steps are and what that would take. And essentially that's who we would hope to be able to contract with, partly because then the money's staying in Texas. And staying in state government. We're not
Right.
going. And we think the legislature would look more favorably on that. But we would essentially use them to guide us every step of the way, what the exam development needs to look like and who we need to use and how to do the psychometrics. They don't have the staff to do the physical sending of emails and hosting the meetings and things like that.
Which we can do that.
Right.
That sounds like something more that we could succeed at.
That's what we do all the time.
Yeah. In terms of, I won't betray specifics of who we've talked to, but I will say that we've had really great conversations, literally from coast to coast, with stakeholders inside of state agencies and outside of state agencies. Just great psychologists and involved in the education and the profession. We can include, if we went to partnering with UT, like we can pick, if there's other people who want to be part of this conversation outside of Texas, there's no reason that they can't be part of this conversation, correct?
Absolutely. And that's one of the benefits of our position is we are not starting from scratch trying to identify the subject matter expert pool of folks. We literally license all of them in Texas that would be the subject matter experts in Texas. And we have relationships with all the sister agencies in other states and the associations who have been vocal supporters already also have those relationships.
That's kind of the best of all worlds, I think.
In a world where we're forced into doing this, yes.
Yeah.
Robert, I have a question. So what is the, like, for where we're at today? I mean, does this go back to the, because I mean, I think the psych board, you know, could have some really good insight too on this, just in and of itself. But since we've all taken the EPPP and the ones us that are obviously that are psychologists and the LPA. So
I took the practice one, don't forget.
Oh yeah. So, I mean, at this point, what do we need to decide today? Like, is it just talking about it, getting the discussion out there, or does there need to be motion today on something? Or because it's kind of hard to make this decision in this quickly, you know what I mean? And
sure, this is really more just asking, what it is asking for a decision on is the approach, not so much the who would be involved. So yes, we would expect to involve the psychology board a lot more in some of the discussions about who would be, what target committees would there be, what targeted professional settings and expertise would we need to gather, what domains should be on the test, those kinds of questions. But we felt like this question is a sort of agency resource question that is going to take a time and attention of staff. And so that felt like the council needs to be the one to decide where the people and money start to go.
How does the staff feel? And they're the folks, you are the folks that will have to deal with this, giving the two compacts that you're going to be dealing with and just the regular course of business. I'm thinking particularly of the you're trying to look at an ombudsman and some of those needs. If your staff were acting independently of the board, of the council, how do you think they'd lean toward a particular option?
I think that if ASPPB came back tomorrow and said, we give up and we're fine if you want to just continue the EPPP one by itself, I think we as staff would strongly urge that let's, eat our feelings a little bit, but just go with that because that's better overall for everybody.
If that happened, I can eat my feelings. I
Me
can
too.
But they have scorched so much trust with the let's talk about it, let's talk about it, let's talk about it. And to be met with this last letter that says, yeah, we're not going to change.
Sure. Yeah. Not
there would have to be some bylaw changes or something, some assurances that this isn't going to happen again.
How about a contract?
Sure.
Yes, I agree with that.
But otherwise, to be, and Daryl, you please jump in, but I think he and I especially like to do things the right way. And so it may be harder to do option one, but it's never sat well with me to spend a lot of state money on private companies that give you a mediocre product.
Yeah.
Good.
Can you give any insight to?
You're still muted.
Can you give any insight to UT's attitude? Were they excited about this? Was this positive conversation? Like what was the temperature and tenor of that?
I will say generally positive. I
Okay.
don't want to say anything more than that because
Okay.
they have a whole leadership that they would need to discuss to even agree. So
Perfect. Yeah.
but they were not negative.
Okay.
Sorry, Daryl, you look unmuted, but we're not hearing anything. Still nothing. Your mic's gone. Well, Daryl was
So
going to.
we need to make a
Nice.
decision on option 1 or 2. I think 3 is a non-starter, as John said. Do we need to like actually make a decision on that today? Or, I mean, I think the UT option sounds the best to me at this point, but again, it is going to be a lot of work for staff and for everyone involved. So just kind of the option 2 kind of takes it completely away, but then again, no agency control and no, we're kind of outsourcing the whole thing again. So just, I mean, it's kind of a tough call there because, you know, it's somewhat new to me in terms of what this process would look like. Obviously it's new for everybody. So,
we could certainly pivot to option 2 if we went with kind of option 1 today. 2 is relatively easy to pivot to if something got.
I feel strongly about not pulling staff off of what is mission critical work. If we can get the funding and we can outsource it,
go with 2.
I'm strongly on option 2. Staff needs to, especially we have less people than we need here. Let's get the funding. You can do some work with the contractor that will be in charge of this, but that keeps staff on the mission critical objective.
And really the decision point, it really just, the immediate thing is what do we put in the LAR request? And so, yes, that would be, I guess in some sense, if you are leaning toward option 2 or want the ability to do option 2, we should probably start with option 2 because that's the larger request.
Okay.
And we can always decrease the request.
I agree.
Or if UT, again, not getting ahead of ourselves or them or anybody, but if they got excited, you know, and we get further down the road and want to go that route and they're prepared to, you know, we can figure out the staff problem, then we could I think that would be my preference if we get to that point. But Chair Hallbauer, I agree with you. Kind of begrudgingly, but I agree with you.
I agree with you, but I also agree. I mean, but here's the kicker for me is if we're going to make an exam, we need to make a good exam, a really good exam. And, you know, I think that problem of just outsourcing it all puts us right back in the situation that we're currently in. So, you know, if we can request the funding that would cover option 1 as well, if we went that direction, I mean, would that encompass that if we decided to if we could get it turned to where we had UT guidance? Is that a possibility? I mean,
they could still certainly be in the conversation.
It's a tough call to make, like in a meeting so quickly. You know, it's just I definitely want to get the test right. If we're going to do it, it needs to be done right. Like the work.
I view it as we're hiring the experts to do it.
Right.
The top authorities and, you know, effective quantitative testing. And
and partly this will give us direction. Staff is going to have to do a fair amount of work no matter what.
Yeah.
Part of it is, do we spend the next several months leading up to the legislative session starting down the path of implementing and building an exam? Or do we spend that time working on developing contract language and a request for proposal to seek the company to do that work? Partly we don't have the in-house knowledge to even know what we would need in that contract. So we will need to get assistance, possibly from UT, possibly from someone else, to even put the bid together to know all the bells and whistles we need to ask for.
Yeah.
And so
timing is the essence of the essence. So, right, that makes a lot of sense.
I think we go for option 2, and then the idea you can pivot if we get staff positions and we want to take on, you know, option one, or if the legislature says we love this idea, go talk to UT. And if because they could certainly give us that direction. That gives a little bit of deference to the ledge on how we deal with this. I think that would be prudent.
Daryl, is that you on 325, the number that just came up?
Yes, ma'am, it is. I'm having to dial in.
Okay.
Daryl prefers one.
Go ahead.
Yeah, my preference is option one, but I'm bed out a little bit on y'all's discussion, so I don't want to chime in here because I really don't know where y'all are at in the discussion.
What?
I mean, I prefer option one as well, but I also would love to get some feedback from shareholders and from the psych board. In addition, if option two allows us to pivot into option one, then we can go that route. But if it's just like an all or nothing, one or the other, that's just it's an extremely tough call to make.
Here's one concern I had about starting with option two and not. You need to have something built into the LAR that allows you to pivot to option one, and because you're going to need the FTEs to do option one. You're just asking for money in connection really with option two, because you pay them a fee, they're going to build it, they're going to maintain it. I don't know that, I can't remember, Robert, if I don't remember us discussing we would need FTEs for option two. So if option two, what do you do if nobody bites? And you ask the ledge for the money, and now you don't have a vendor that says, well, we don't think
then you pivot to option one.
Well, and keep in mind that ASPB is the only one that's had an exam since 1965. So like, we got to think about that too. It's not like people aren't making these exams because this is the exam that has been used for so many years, at least for part one. So, I mean,
So it sounds like, would it be appropriate, is the advice we're hearing from y'all, and we'll vote on the LAR request in a moment, but to request sufficient funds to hire a private company to do stem to stern, but also request the additional FTEs should we need to implement it more through staff. Yes. And certainly even after the exam is developed, we'll need staff to implement it. And
that also still gives deference to the ledge within that request. And when we get to go explain that, we're like, well, you're asking for a lot. Well, let me explain why. And they can give us the feedback on what they're willing to give us.
True. Just having being authorized for FTEs does not require us to hire it, and being given money does not require us to spend it.
And we've, again, back to what I said earlier, we have a strong track record of giving back money that we didn't use, and they've trusted us so far. So,
but we're already 5 FTEs short without this.
I agree. It's a problem. I agree. I don't
completely take a brand new test out of the equation. We're 5 FTEs short. We discussed that this morning. And I view it as we request the additional funding and we get the additional funding, and then that funding gets transferred to our subject matter expert contractor who can develop this test. Minimum staff involvement. You guys need to stay on mission critical work. You're 5 FTEs short right now without this.
Right.
I will say that when I go back to my board, if I go back to my board with that message, the message from the stakeholders that show up at my meeting would say, this is mission critical work. This is absolutely, Mark, would you?
Right. This is mission critical work for us.
And sure. I understand your point. What I'm so frustrated with is not you. It's the fact that this problem has come to us, because this is not the problem that I want. There's so many other things that we should be working on, but it is because of ASPPB's immovability. We have tried negotiating in good faith for anything. And all they've done is drag this out and put us in this box with this timeline, this artificial deadline of their creation that affects us in such a real way. All the things that you're describing here.
Oh, totally understand.
So if I go back to my board with that message, this is mission critical, because the idea of no test is completely unpalatable to everybody, myself included. Like, we have to fix this.
Does it also help, Chair Hallbauer, thinking in practical terms of the LAR. For one thing, I'm pretty confident in saying that this is one of the reasons Daryl hired me. And so I think I'm probably the only I think Daryl will work some on this and Patrick will work some on this, but mostly this is going to be in my lap. I don't believe anybody.
Daryl's nodding.
Yeah, I don't believe anybody else at the agency is going to get taken off their work for this. This is there. We have no other positions to do that would be taken.
You're trying to hire 2 attorneys,
but yes, and that's the other thing.
We don't even know if we're going to get those guys.
And I was going to say,
what's going to happen? We don't get the 2 attorneys that we talked about this morning. How are we handling this?
We get to the whatever number of FTEs the legislature gives us, we then hire those people. And so
then what's the priority?
The filling staff, I think. Well, I guess y'all would decide. Y'all would tell us what the priority is.
I think that what Mr. Hallbauer is trying to say is that we don't want to slide back into a position that we were in when we started BHEC. And I don't see that happening. Your staff has been moving. There might be a little slide initially. And as you've mentioned, there's a little that's growing as the state's growing, as needs are changing. Can you, for instance, can you hire attorneys as 1099s? Maybe, I don't know what the government regulations are about that, but there's certainly a pool of people from which to look. I really appreciate your point, Stephen, and I think
let's be absolutely clear. I am for this.
I understand.
I am for pursuing a test option.
Mm-hmm.
However, I am not for pulling staff and especially when we are requesting additional staff for needs that are completely unrelated to this.
I understand that
I view
as
this as a one-off extraordinary event that we will seek one-off extraordinary funding to address. And we get that funding, and then that funding is used for solving this issue.
At the same time, we hire an executive director to lead us. That executive director, in his judgment, the first option is something that he feels and he can accomplish with either with a combination of the open requests or the staff he has now. He obviously thinks he can start and finish this, or he wouldn't be recommending it. I'm leaning toward Daryl's confidence in his team and his having looked at what we need to get this done. After all, we've been thinking about this since April. Wasn't that when the psych board met? That this is, newish to our council and certainly to the public, but it's not new to our staff. My inclination is to trust Daryl's leadership. And not only do I think we could pivot from option 1 to 2, I think we could probably do that as easily as we could pivot from 2 to 1. We have some very capable attorneys on staff, and maybe I can voluntold you and we can voluntold others and get to a contract. But I think that the greater issue is, what do the stakeholders and the providers that are in the pipeline, if you will, what do they need and deserve from us? And then let's think of the legislature as our partners.
And I appreciate those comments, Chair Canseco. And I mean, I think Robert made a great suggestion of, how we could essentially ask for the money that we would need that would encompass option 2. And then we could, I'm not exactly sure the wording, but you mentioned that the ability to sort of pivot onto 1 if need be. Is there a way we can word that into a motion that would work? That would
it would be ask for the funding for option 2, and then full-time equivalent FTEs, the full-time equivalents units to complete option 1, and it just kind of puts the prerogative with the legislature of what they're going to give it.
And our director.
Yeah, because in that case, what the legislature would be doing is just changing the cap of FTEs, and so it would be not asking for additional money for the FTEs. It would just be saying, well, this is the greater sum that you're asking for option 2. If we pivot to option 1, we would use less of that money, some of which would pay for the additional FTEs. So it wouldn't require additional funding for those FTEs.
Yeah, I
just
gotcha.
authorization to hire them instead if we pivot.
And if we didn't, then I would expect that we're giving a lot of that money back to the ledge.
Sure, which that's the right thing to do. Daryl, are you comfortable with that? Is my assessment of your thinking correct?
You're talking about starting with option 2 and then building in.
I'm talking about, did you think out what was best for your staff and what they could accomplish when you put this entire plan together?
You know, when we were talking with UT, the type of staff you're going to use to carry out the initial groundwork for option 1 is not going to be the line staff, the LNPs, the investigators, or really the staff attorneys. It's going to be Robert, myself, and Patrick and Jim. Those are the 4 people that are going to have to bear this brunt. I'm not going to lie, just after talking with UT, I've told Robert and them this is like another setting up BHEC. It's going to be that level of work. But Robert, I will say this: there were a lot of people that told me you couldn't do BHEC because they told me, I got told several times early on that it's not going to work, it's going to fail. And I kind of made a pledge that I would move heaven and earth to make sure it did work. If nothing else, to prove them wrong. But so I think this is doable. You're right. It's gonna take a lot of work. Robert's probably gonna bear the brunt of it. I think we can do it, but I do get your concerns. I 100% see where you're coming from. Coming off of core mission, I think we could do it. Initially though, I really do. I'll be honest with you. I'm kind of one of those guys where when it gets sticky and there's a hairy challenge that a lot of people are like, I don't know how we're going to do this. That tends to kind of stir or motivate me. I'm wired to want to get in there and go, well, let me show you how you do this.
Daryl, this morning, the message was we're 5 employees short from where we need to be for the work we have right now. Okay. That was the story this morning.
Right.
And now the story this afternoon is, well, let's do a whole new BHEC level project. That's insanity.
But remember, those employees that we're short on, those are not employees that would be working on this anyway. We're talking about an ombudsman. We're talking about hiring 2 new staff attorneys and I think some admins, if I'm remembering right, that are in there. None of those positions would be used. And Robert and Jenny and I aren't doing that work. We're not filling in those needed areas right now. So we're having to kind of cobble together other staff to handle that. So I don't know that we're taking.
Daryl, I don't like terms like cobble together other staff to do something. You're understaffed right now, and we want to do a Herculean new project, which, don't get me wrong, I'm for. It's just I think we have different views of how to go about doing it.
I get everything where you're coming from. I really do. I really do. But we're coming to different conclusions on this slightly. We're in the nuance of this. And the reason is that I'm the chair of the psychology board. So like I see all the psychology parts of this, and all of the trouble that's going to come with. I understand why Daryl and staff and why there is a desire to maintain more control over the test. To Dr. Cartwright's concerns, I think Dr. Cartwright voices the concerns about a quality test, and the way that we guarantee the quality of the test is by retaining control. And because we've experienced
and working with experts in the field of testing. Correct?
And
I think that we're getting into micromanaging the job of our staff. I believe that we need to point to a direction and our staff needs to tell us how they're going to do it.
Ms. Pryor.
Sorry, Ms. Pryor has her hand up.
Yes, I was listening to see. I heard someone say that you were gonna go to ask for the money. Has an assessment been done already to determine accurately or within a range to make sure how much money it's going to take for option 1 or 2? Has that study already been done?
Study the RFI.
No, unfortunately, yeah, we have started down that path. We have put out a request for information asking for testing companies and others to provide us information for how they approach this sort of project and how they might cost that out. The best information we have, though, right now, while we're waiting for those responses, is to look at how much we understand folks like ASPPB spent to make their test as a comparable action.
So before you go to the legislature, you're going to complete that before you go and ask for.
Yep.
Okay.
Yes. And
we are in agreement.
Yeah.
Okay. Okay.
So perhaps may I make a suggestion that there is time between now and when the legislative session starts. Part of the artificialness of making this decision now is we need your approval for the LAR request.
Right.
And certainly asking for it may be strategic to ask for the larger amount of option 2 now and always ask for less. If we then if I could spend the next several months working with Darryl, working with UT, plotting out more specifically what this is going to look like and what the workload's going to look like and our capability of doing this, to then come back to you and reassure you that it is feasible, that it is not, or come back and say,
okay,
you were quite correct. Our eyes were bigger than our stomach, and we need to just.
I think that no matter what the decision is here today, like you've heard loud and clear the concerns. I'm sorry, you had something.
No, I was just going to say I agree with what you're saying right now. I too share those concerns, but during sunset, the two options were TDLR or BHEC, and we got this because the 4 of us could work together. And so I think when one needs help, the rest of us just gotta stand up. And right now, psychology needs help, and so I think that's what we're here to do. And it's not going to be easy. It's not going to be hard. I mean, it's definitely going to be hard. It's not going to be easy, but we're going to get it done. We're going to do it right. We're going to do the job, and we're going to do it right, because that's how we do stuff in Texas.
Okay. Robert, is it time for a motion? Is it? Oh, I forgot. I'm not sharing. Where are you, John?
By the way, I appreciate everybody's comments and yours as well, Mr. Hallbauer. Thank you guys all, and I completely understand as well the concerns and from cost to outsourcing and burden on staff. I 100%. But I do just think we need to get this right if we're going to do it, and I really like Robert Romnick's suggestion of allowing us to have the appropriation for what we need in case option 2 is the best. We may find that is just the better way to go, and then we can change as needed if we need to, or do what we need to do. I don't know the correct terminology for that, but we can do what we need to do and adjust and adapt accordingly as we learn more information. And this at least gets the ball rolling on the LAR, and then we can kind of figure things out from there, because it's a lot. There's a lot of work to be done, that's for sure. But I appreciate everyone's comments on all this. This is
that a motion to?
Well, Mr. President, I remember given what I think I'm hearing, I think the only motion y'all will need to do is just approve the LAR exceptional items as drafted, because we drafted it at the highest amount.
For both? For FTEs as well?
It does not specifically include FTEs, but that doesn't have to be.
Okay, so we don't need, okay.
We've heard your general direction, and we will submit the
message received.
But if y'all will approve the LAR items, that gives us.
Okay, so with that, further discussion on this?
I can make a movement if you want me to.
Hang on, we're gonna go into the LAR in just a second.
Oh, okay, sorry.
Hang on, Chair Hallbauer.
I do feel as though my concerns have been expressed. If the motion is to request the LAR at that full amount, that includes option 2, which I believe is the correct direction to go. And so I would support that.
And if staff gets pulled in too many directions, you're going to be hearing about it from Chair Hallbauer. Right?
Yeah.
Maybe me too. Me too.
You guys have done such an extraordinary job of getting to the level that you're at right now. And this is taking a huge risk that you're going to sacrifice that level that you guys have worked so hard to get at, to where we come in here and basically we rubber stamp your numbers because they've been so good. And you're running the risk of losing that. We're absolutely clear on that.
I'll be upset if I mean, I am upset already about what ASPPB has done to us. I'll be more upset if our reaction to this puts us in a worse place. And so, like, I think that Chair Hallbauer's points are well taken, well made, of what's at stake. Of this is more than chasing a rabbit, but it could really distract from the core function. So let's not do that.
Is there any sense of other states wanting to share the load on this?
Yes, there has been general positivity from certain states, not to the extent that anyone's been willing to go on record yet on that. I have heard things like, we're for it. I just don't think that there's the appetite for us to be first.
Right.
But I don't let the lack of public, I don't know, anger, volume, support, whatever. Don't let that. I think it's out. I'll be real surprised if we're still here standing alone in a couple months.
Banks and Baptists, I believe, they're the only ones like to be first.
I don't know that one. Anything else?
I'm gonna end on a strong.
Okay,
I thought
we'll
that was
leave it
good.
there. Okay. So that's a good time to go ahead and go back to item C, where we delayed the vote. Review and approve the exceptional items for the 2026-2027 LAR.
So moved.
Second.
I'm sorry, who was the second?
Brian, me.
Second. Is there any further discussion? All those in
And
favor?
this is everything listed in the
Everything
LAR.
listed in the LAR with the big number for the test and some other things.
All right.
All right. Any further discussion? All those in favor signify by saying aye.
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 Opposed, say no. The ayes have it. All right. Thank you very much. Just knocked off 2. Okay, we did the bid. Chairwoman Canseco, discussion regarding public education efforts needed to emphasize the benefits of seeking services from licensed mental and behavioral health care providers. Item F. Do you want to take that now? Sorry, you're muted, Chair Canseco.
No, not right now. I'd like to table that for the next meeting.
Yes, ma'am. We'll put that on the next one. Reciprocity agreement with the state of Oklahoma. Anything we need? We are for reciprocity. I'm for reciprocity.
Yep. Statute allows us to enter into these agreements. Daryl's worked hard to get this agreement with Oklahoma. They line up with our requirements. They've already adopted this. We suggest you adopt it too.
Is there discussion or a motion to approve that?
This is psychology only.
Yes.
How do we get one of these cool things?
Because it's in chapter 501 and not in any of the other chapters, unfortunately. So there was a bill
We
last.
tried.
Yeah,
We
to add it to
tried last
507.
session, Dr. Taylor.
I mean, maybe if we get this test sorted out, maybe we can focus that out. We'll work on this one next, you know?
Is there a motion to approve it?
Make a motion to approve.
I'll second.
It's moved, seconded. All those in favor signify by saying aye.
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 Opposed, say no. The ayes have it. Thank you very much. Revised organizational chart. Any questions? Any explanation y'all want to give or move to approve?
It's because I'm here. adds me.
Okay.
I moved to
We want to
approve.
keep you here.
Roberts.
It's been moved.
Second.
Any discussion? All those in favor signify by saying aye.
Aye.
Oppose? No opposed?
Oh, no, sorry. I was late. Aye.
Aye. No opposed. Ayes have it. Okay.
It's because I got up at 3:45.
Update on quadrennial rule review and discussion about the need for an ad hoc committee.
All right, that's me. So in your materials, there was the proposed I seem to have left off one. So last meeting, I talked to you all about the rule review process. We have now as staff gone through and looked at all the rules of the agency and come up with our initial findings. At each of the individual professional boards meetings over this last month and into July, I will be presenting all of those findings. What we need to do now is get your approval to propose the official rule review in the Texas Register to implement that. And so in one motion, y'all can adopt the 5 Texas Register postings to actually officially start rule review. From that, we will then have town halls that are scheduled for each of the professions during the summer. And getting all of that feedback, we will come back to you at your October meeting with the final findings of the rule review, which will include adopting the findings as sort of an official stamp that, yes, we've done rule review and we're readopting all of our rules, as well as proposing any statutory repeals that are required. Sadly, I do not have the PowerPoint. And Daryl, if you're on the S drive and can email that to me, I can't access the S drive.
We can come
Hey,
back.
can you hear me now?
Yes, sir.
Okay, let me try that. I'll see if I can email it to you.
You gonna table it and come back to it?
If you don't mind, because I'd like
Not
to
at
at
all.
least show you very quickly what the BHEC rules are that need updating. It'll be very short.
All right. Do we want to talk about the OAG opinion that we may need to seek?
Yeah, I can speak on that real quickly, and I can kind of give just a quick high-level overview, and I can go into any more specific details if you'd like. Generally, what this relates to open records requests, and we currently have a previous determination for open records requests when there's let me back up. There's a statute that makes all complaint information confidential, and we'll receive open records requests for those. And so there's a process we have to go through to deny access to them because, of course, they have, PHI and all sorts of other confidential information in them. We have a previous determination which that the Attorney General has issued that we can rely on when certain requesters ask for that information. Part of this request is a clarification of that, which is what qualifies as a party. And so the term party is used in multiple places in Chapter 507. And I think the term is used differently in different statutes. And so part of this is looking at it and trying to get a specific clarification on that, because we can then rely on that previous determination for other types of open records requests. And essentially it will it'll streamline the process of handling these sorts of open records requests. So it would be more efficient and be easier for staff to handle these sorts of things. So that's kind of generally in a nutshell, but it's looking at it like, what does that word mean? And it would seem obvious, but if you read some of the other statutes, the way it's used in some of the other parts of 507, you could say there's an argument.
Ways. Or?
Sorry?
I mean, there's different, it goes both ways on how.
Well, so there's what is it in 507, 203, and 204? It says it uses parties to a complaint, and then in 205 it says parties to a disciplinary action against the license holder. And so parties to a complaint, if you look at those two statutes, I think clearly what the legislature is intending is those statutes are talking about notification, and the parties would be the complainant and the respondent licensee. And so it's talking about notifying them and telling them about is it still open? What was the outcome of it? That's where they use the word party. But if you look at parties to the other phrase, party to a disciplinary action against a license holder, I don't think a complainant was intended to be a party to it, because it's a party to a disciplinary action, and a party is if you look at like the Texas Rules of Civil Procedure and that what is a party to a complaint, that's somebody who has standing to be part of that lawsuit, right? So I think there's a very strong argument to say, no, a complainant shouldn't be a party to it, because they can't file a case at SOA. They don't have a right to discovery or a right to cross-examine witnesses. They're just a complaint. It's much like in a criminal trial. So
kind of like the DA representing.
Right,
Okay.
exactly. But I would prefer to have the Texas Attorney General clarify and say, yes, we didn't mean for that, so that if a complainant files an open records request, we would then say, okay, we're just going to say this. If we're reading it wrong and that we don't get an answer in the affirmative as what we think we're asking for, and we get it wrong, we would then be required to release that confidential information. So that's why we're asking for this, to make sure that we're clear that we can withhold it under that previous determination.
Yeah. That's a 3-page letter about one word.
Yes.
Great job. Yeah.
I could have made it longer, but
No, it's an interesting question. Let's send it.
Is that a motion?
We need to approve it.
Yes.
Is that a motion?
Yeah, I'll make the motion. Then we
Remove.
send it.
Second.
Second.
Moved and seconded. All those in favor signify by saying aye.
Aye.
Opposed, say no. The ayes have it.
And
All right. Do you want to come back to the rule review? You ready for that?
Yep.
All
Ready
right.
for that.
Going back to item K.
So on your screens now is the PowerPoint. This is one of the 5 PowerPoints. Each of the professions has ones too. They're now uploaded to our rules page on our website, so everyone can see this. These are staff's initial findings of things that need attention in the rule review. Again, for the public, nothing is being proposed right now. This is just documenting what we think needs to be worked on, and any rule changes will be proposed in the normal way with publication in the register and time for comment, etc. The first group are provisions that we've identified that need to be repealed because of any sort of statutory or jurisdictional problems. Or just problematic language in the council's rules. The only council rule we identified is that in the rulemaking, there's a redundancy that says the council may make non-substantive editorial changes. It's listed twice, and it shouldn't be. Then we've also identified several concepts that we want to bring to the council as sort of the standardization committee idea of concepts that could be harmonized across the board. These are things like court-related practices, where sometimes the professional rules talk about what the profession should do in order to maintain their practice and to be practicing effectively, but sometimes it gets into the jurisdiction of the court, who gets to decide who's hired by whom, who reports to whom, how do they get paid. Those are all things the court gets to decide. So we want to make sure we're not infringing there. Military-related applications. These are ones that are governed by Occupations Code Chapter 55. We have our BHEC rules pretty closely follow this, but we want to make sure the rest of the board rules don't conflict in any way. So we're treating military service members the same for all of our boards. Board meetings, committees, agendas, etc. We have various rules. The psychology board doesn't have any rules. The other 3 do. And some of our committees have 1 member, some committees have 2, some have 3. They meet at different times and meet in different ways. These are not necessarily requiring standardization, but we thought it was worth a conversation to make sure if each of our professional boards have a difference, they're doing it intentionally, not just because this is the way it's always been done. Telepractice, this is really just to align our administrative terminology and make sure now that we do see telepractice a lot, that we are making sure it fits within our existing rules and using correct terminology. And then some things like, this is one example, but definitions, making sure there are 3 provisions that define a religious practitioner. They're pretty much the same, but they're not quite all the same. And it seems like as an agency, our definition for things should be the same across the board. Unless, again, if we discuss and find a reason for there being a difference. We found a few things that need amendment, not because there's a jurisdictional problem or statutory, but just because it doesn't really align with our operations anymore. There is a requirement that people wishing to offer public comment must sign in. Well, now we have virtual attendees. We do not have a sign-in page. Folks who come in just identify themselves. We don't need a sign-in page. We have rules that talk about main address versus home address, and especially within the recent changes to protect confidentiality, we need to make sure our rules are clear about when we're talking about a private home address versus a business address that is intended to be disclosed. Criminal history background checks. This is the fingerprinting. There's an exception for folks who underwent a fingerprint-based criminal history previously. We need to clarify how that works for people pre-BHEC licenses and whether or not they are required to re-fingerprint. Probable cause hearing rules. And this is just an operational. We want to clarify when you have to send a notice versus when you have to appear. We'll be bringing these to you in actual rules, so we'll explain it to you then. It gets dense even for me. There's a rule that talks about a reinstatement fee. We do not have reinstatement fees. They're just renewal fees. So clarify that. And then some other clarifying things, authorizing us to accept alternative forms of proof of licensure when necessary. Some of these rules we're already bringing to you, but again, trying to streamline and reduce burdens where possible. All of these ideas were at a mind to where we have requirements in the rule that aren't actually meaningful or necessary. Let's get rid of them. And then finally, there's a few provisions that are in one board that seem like they could be good rules for the rest of the boards. And so these will be topics for discussion at a later time. Things like the psychology rules discussion of how you use assumed names in your practices looked pretty good. Things like there's a guideline for managing the sale of your practice in the psychology rules that might be useful for other practitioners. That's not in other rules. The LPC rules have specific content definition for what do we mean by indirect hours of experience? How do you guide what's an allowable hour of experience when it's not direct contact? That might be useful for other professions. So all that is to say, lots of things to discuss, other future considerations, even once we get past those. Not going to go through all of these, but they're on the website for the public to see. We will bring them to you as we get through this, all the monumental task of looking at rules. But just to show you that we went through them all.
Do you need a motion to approve that?
I do not need a motion at this time to approve that. What I do need is just a discussion and maybe a general agreement, although you could also do as a motion. We have a standardization committee already developed. That is a joint venture between the board and the associations. In the event that we have a substantive question, we could use the full standardization committee. But what we would like to do is, for some of these operational things, use the 4 professional members from the council that are on the standardization committee as a ad hoc rule committee for the council. Council doesn't have a rule committee. This would give us a chance to just meet with those 4 folks and hash out our proposed language before we bring it to you. So that's our intention. if that sounds right to everybody.
I see nothing wrong with that.
So I don't, Daryl, do you think we need a motion to officially form the ad hoc committee?
Yeah,
or-
you do. Yeah.
Ad hoc rules committee.
So moved.
Been moved.
Seconded.
Discussion? Without objection. You have it. Without objection. No one
Oh.
objected.
Yes, sorry, I went so quickly. I do need you to vote to approve the register notices.
For rule
For
review.
review. The
Those
proposed-
5 that you
Yeah,
talked
all
about
the-
earlier.
Just
Yeah.
the postings. Yeah.
Yeah.
That's no big deal. So moved.
Seconded.
All in favor, signify, oh, without objection. Moved, seconded. There you go. And no one objects.
Do that.
I'm gonna, well, on some of this stuff, I am gonna do that. Yeah.
Like that.
Y'all understand, if you object or want to vote on it, just say, let's have a vote before I hit the gavel. All right, that concludes 5. Unless somebody sees that I missed something. Are we good to keep plowing, or do we want to take a 5-minute break before we get into rules? Let's take a 5. We'll stand. Okay. All right. We'll go ahead and get into rules then.
I mean, if there's no objection on any of these.
So do we? I'm looking at. We can take them in mass, I believe. Correct.
You're certainly allowed to. I can try to give a 1-sentence explanation.
Give us, yeah, for our benefit and the public's benefit, for what we're doing. I just went through while you were doing that, pulled up the BHEC ones. A couple of those look like there's some specific reasons that you're probably asking for some stuff, and some other things look like just cleanup. So if you can describe what we're doing here, that would be great.
Absolutely. I'll give 1 sentence for each one, and you can tell me if you have questions. So the proposal of 882.14 is a waiver of deficiency rule, essentially under the general principle that if the agency has developed a requirement in rule, it has the authority then to find exceptions to that rule. This would create what is already in the rule several places for several of the boards in narrow ways, just a general statement that says any of the rules that each board has created that is not a statutory requirement, they can find good cause for why that should be waived and or require some sort of remediation to allow somebody to get licensed in an alternative way.
Yeah, and the reason for this rule change, I can think of a couple of situations from psychology where we have had applicants who are absolutely, no one's debating their qualifications and that they're ready, but there's some snag in the rule that is either not relevant or ticky-tack or whatever. And there's easy ways that we could either remediate, ask them to do something else, or supervise them in some other way, which the rule doesn't actually, we shouldn't be just doing stuff willy-nilly. There should be some guardrails and guidelines on that, which sounds like what we're doing here.
Exactly.
Okay.
The change proposed in 882.21 has to do with license statuses. There's a little bit of cleanup language, but particularly this is to put in clarity that if someone has a complaint against them, they're not allowed to let their license expire and walk away and void the jurisdiction of the agency, that their license will remain active until the time, or delinquent, depending on what it is, until the time the complaint is resolved, then it may be allowed to be expired.
You can't run the clock out
Can't run the clock out.
to avoid justice.
Yep. That's pretty much, and the rest is cleanup.
Okay. Is there a motion to, these are to propose, so is that correct? These are proposals?
Sorry, I meant the rest of that rule is cleanup. Let me look at these 884.10. Oh, 884.10 is a new, is to allow us to dismiss complaints when we can't tell from the complaint what exactly violation could have occurred. Right now, we're having to investigate even if they haven't given us anything other than you should go look at their billing. What do you want us to look at in their billing?
Right.
So we'd like to be able to dismiss that. 884.60 is about depositions of witnesses and creating a way for the attorneys for a respondent to request somebody to be attending at a SOA hearing, and how that's going to work and get paid for. That's updating that rule. And then general cleanup and updates to the executive council fees.
Okay, so we can, and these are to propose, not adopt, correct?
Correct.
So we'll get another bite at talking about these at the next meeting as well. Is there a motion to propose these rules?
I move to propose 882.14, 882.21,
For the fees, do we need to mention that change?
884.60, and 885.1.
885.1. It's been moved and seconded. And without objection.
Okay.
Those are proposed. Okay, 882.2.
This is consideration for adoption. This was previously a rule to allow us to rely upon verification from another jurisdiction, their website, their emails, whatever we feel like is good enough from them to verify the other jurisdiction's information.
Fair enough. They're moved to approve.
So moved.
It's been moved. There's second.
I second.
Been moved and seconded. Any discussion? And without objection, that's approved. All right. Marriage and family therapist. Let me pull this up unless somebody wants to start laying that out.
Sure. 801.114, dealing with academic course content. This one will actually have a change from the one that is in your packet. This was one of those that was being proposed to create a waiver option in an individual rule. But now that if you have approved the proposal of the global waiver rule, we no longer need the individual one, but we do need to still propose repealing subpart D that is not authorized in statute. And so what you see here is a proposed underlined new D that we would not go forward with, and instead it would just be the struck through D as a proposal.
Because it's duplicative.
Because
So-
it's taken care of by the one you just proposed.
But under the BHEC, under the
Under
BHEC
BHEC
rules?
Yeah, which would
Exactly.
apply to all four boards.
Okay,
not just
so
this one.
the one that we're looking at 801.114. And you say that one more time. I'm looking at, you've got a
So-
highlighted part and D, the last
Exactly.
D is struck through.
The highlighted part was a new rule that the MFT board was proposing to create a remediation option. That was before we knew there was going to be a proposal for a global remediation rule for BHEC.
Okay, so the motion is to proposing this with not the new addition, just the deletion.
Exactly.
Okay. Is everyone clear on that? Any questions? Y'all are keeping it interesting for us over there at MFT. Thank you.
We do our best.
This is later in the day. We had to do this stuff earlier in the day so I can keep it straight. Okay. Sarah, is there any discussion? Or is there a motion?
I make a motion.
Okay, and the motion is to propose it with the deletion of D, not the proposal of D. Is that correct?
Right.
All right. There's second?
I'll second.
Then second, moved and seconded, and I'm going to pass that without objection. Objection. Thank you very much, guys.
801.115 is a rule about out-of-state licensure that does not comport with Chapter 502 of the Occupations Code, and so is just being suggested for repeal. We will be bringing back to you a new proposal at your next meeting that does comport with the statute.
Okay. Discussion? Motion?
I so moved.
And moved. Is there a second?
I'll second.
Moved and seconded. Further discussion? Hearing none. Without objection, that is passed.
801.142 regarding supervised experience, mostly a lot of cleanup language but specifically clarifying that supervision may be done the default is to be done in person or by live video. But if the supervisor determines that neither of those two options is accessible, then you can supervise by telephone. So that way, eliminating a specific number of hours that is authorized to be by telephone, and instead leaving it up to the supervisor to determine, well, if in-person or Zoom is available, no telephone, but you get the idea. And also adding a grandfather clause to a provision that would count excess graduate internship hours that is also not strictly authorized in statute. But the MFT board recognized that there may be folks that are in degree programs and relying on that, and therefore wanted to phase it out rather than purely repeal it.
All right, y'all have seen that proposal. Are there any other questions or comments? Hearing none, is there any motion?
So moved.
Move to, sorry, this is we're proposing it. Move to propose 801142. Is there a second?
Second.
Second.
Seconded, a lot of seconds. It sounds like everyone's in favor of that without objection. It's passed. All right. 7, Bravo. There are no rules considered. Okay, sorry. We're going on to 8. Psychologists.
46325, repealing the health service psychologist specialty certification, which is a certification we do not regulate and was essentially put on licenses for the oral exam that is no longer there and is just something we don't need to put on
Yeah,
licenses.
this is just an artifact from things that we used to do that we don't do anymore, and it needs to go away.
I've never even heard of it.
Exactly. It's not used.
All right.
No one's going to notice this being, because it's not, we don't use it. So, I'm sorry, this is proposed. Is there a motion to propose?
So moved.
Moved by Dr. Cartwright. Is there a second?
I'll second.
And it's been
Second.
seconded. And without objection, that is proposed. All right. We have no adoption for psychology. Going to 9.
Nothing in 9.
Nothing in 9.
Yeah. No, we've been on our best behavior.
We love it. We'll try to be more like you next time.
Yeah, we just want to be the quiet middle child for a
Yeah,
while.
psychology's not going to do that for a while. Apologies. Social work examiners. Okay, review and consideration. We're doing 2 proposals, 781302.
781302 regarding the practice of social work.
But not 401.
Yeah, we'll get to those. Yeah. This rule, the changes are clarifying, just being more specific about when each license level may or may not practice social work and may or may not practice clinical social work, to just be much more clear and to point to the other code provisions that get referenced in terms of supervision plans, et cetera. The only substantive change in terms of the actual rules is a deletion of a provision that talks about how a licensee not recognized for independent practice may not provide social work from a location that he or she owns, leases, or is otherwise there. This was to prevent folks who did not have the authorization to practice independently from surreptitiously having a business out of their home or pretending that they're working for an agency when in fact they're opening up their own shop. But this doesn't make sense now that we have telework and telepractice and working from home. And so in order to allow agencies to tell their employees to work from home, we're striking this language. It still does not authorize you to practice independently if you don't have that license.
It sounds like a very narrowly legally written thing that was written for a very specific purpose that they did not anticipate the unintended consequences of how it would be read in the future.
One specific complaint.
Yeah.
This is not going to happen again.
Somebody called me out the other day because I had some idea for something and they're like, no, we don't need to write a rule for a specific complaint. I'm like, yeah, that's right. Thank you.
I will say the social work board proposed this yesterday. And so the version in your packet is slightly outdated. They added the term social work to parts A and part C, or part A and part C, just to clarify that the practice we're regulating is social work and not something else.
Fair enough. All right. So with that change, is there a motion to propose that?
So move.
401, right?
It's been
302.
302, 781-302. It's been moved. Is there a second?
I'll second it.
Been seconded. Any further discussion? Without objection, that is proposed.
And Mr. Chair, the social work board did not propose 781-401 yesterday, so that is not here for consideration.
Okay. We have nothing else there, so we're down to 11, report from member boards. I don't think we have to talk about psychology anymore. We've talked enough about psychology, and y'all know exactly what's going on with us.
Got a couple
And I'm
quick-
sorry, Dr. Cartwright, I didn't ask you. Do you agree, or do you have anything you want to add?
I totally agree. I think we're
Okay.
up to speed on things.
Anybody else?
I mean, we're all listeners here.
A couple quick ones from LPCs.
Let's hear it from LPCs.
First, we had a public member resigned. Okay. We're down to 8 members at the moment, waiting on an appointment of a new public member from Governor Abbott. Looking forward to adding them. And did want to, as often as we can say it, the LPC Town Hall meeting on the quadrennial rules review is August 13th. Say that as often as possible.
What day was it?
August 13th. Which year? This year. Thank you, Dr. Taylor.
August 13th.
And
I mean, we're
Robert's
doing
running it.
26 of these guys.
Be there at 11 a.m.
Yeah,
11 a.m.
that's it for me.
Okay.
You got anything?
No other reports? Other reports from the Zoom?
Social work board is August 2nd. Is that right, Robert? For the town hall?
Yeah.
For the quadrennial rule review. And currently on the ASWB website, there is a nationally approved survey that I would encourage anybody out there to go on and complete.
Also, I said yes to coming to Austin for our rule review meeting. I don't remember what date it was.
You said yes to coming for the board meeting on July 12th.
Okay.
Which,
Forgetting all our dates.
next up meeting
Yeah.
will be the psychology town hall. Will be, all the town halls are virtual. There is there will be a room open. You can come here in person if you like, but they are all virtual. And yes, there is July 26th for the MFT board, August 2nd for social work, August 6th for psychology, and August 13th for LPC.
Very good. Future, anything else? All right, moving on. Agenda items for the next council meeting. Brenda, are you doing, who's taking down notes for this? Chair Canseco wanted to move item 5F as in Foxtrot to next meeting. That's all I have. Anything else from the board? Motion to adjourn?
So moved.
Second?
Second.
And without objection, we are adjourned. Thank you, everybody.
Well done, guys. Y'all plowed through a lot.
Thanks, Daryl.
Bye, everybody. Thank you.
Thank you to everybody.